Welcome all the speakers of today's national webinar on Ayurvedic Kriya-Kalpas in the management of eye and ENT disorders. Today's theme is Hamara Ayush, Hamara Swasthya and Ayurveda for Nutrition. This webinar is arranged by Department of Shalakya Tantra, Bal Bhagwan Shikshan Prasarak Mandals, Ahmadpur, Dhanvantri Ayurved Medical College and Charitable Hospital, Udgir, District, Latur. All the speakers, chairman person, co-chairman, all the respected faculties, practitioners, UG, PG, students, all are heartily welcome in this webinar. I request to Dr. Jadhav sir, before starting this webinar, we are going to Dhanvantri Stavan.
शङ्खं चक्रं जलौकां दधतम् अमृतघटं चारुदोर्भिश्चतुर्भिः सूक्ष्मा स्वच्छातिहृद्याञ्शुकपरिविलसन् मौलिमम्भोजनेत्रम् कालाम्भोदोज्ज्वलाङ्गम् कटितटविलसत् चारुपीताम्बराढ्यम् वन्दे धन्वन्तरिं तं निखिलगदवन प्रौढदावाग्निलीलम् रागादिरोगान् सततानुशक्तान् अशेषकायः प्रसृतानशेषान् औत्सुक्यमोहारतिदाञ्जघान यो पूर्ववैद्याय नमोऽस्तु तस्मै नमोऽस्तु तस्मै नमोऽस्तु तस्मै नमोऽस्तु तस्मै.
Thank you, Jadhav sir. Firstly, I would like to thank our principal, Dr. Dattatreya Patil sir, to arrange this webinar and giving opportunity me to as a coordinator for this webinar. This webinar has two sessions. First is 2 to 3 and another one is 3 to 4 p.m. The first session, the topic is the role of Ayurvedic Kriya-Kalpas in eye disorders. For this, we have eminent speaker, Honorable Dr. Manjari Keskar, Madam, Professor, Parul University, Gujarat. For this session, we have Chairman, Honorable Dr. Yuvraj Kale sir, Principal, Bhaumulak Ayurvedic College, Nagpur. And for this session, co-chairman is Dr. Praveen Chavan, Professor, Ayurvedic College, Islampur. Before going to start this webinar, I am going to introduce the speaker of this session, Honorable Dr. Manjari Keskar ma'am is a graduate of BMS, MS and PhD. She is my senior also. She is working as a professor at Department of Shalakya Tantra, Parul Institute of Ayurveda, Parul University, Gujarat. She worked as General Secretary of TAS India, Shalakya Tantra Association for 2019 to 2022 and also worked as a treasurer for 17 to 19. Her clinical experience is more than 25 years and academic experience near about 18 years. She also worked as NAP safety officer and coordinator and also worked as a deputy medical superintendent at Parul Ayurveda Hospital. She is PG and PhD guide. Also 9 PG PhD scholars have completed from her guidance. She published many research articles and also invited as a guest speaker in many national international conferences. And another thing is more important that she believes in integrated approach for betterment of mankind. For this session, we have an eminent personality, Doctor, as a chairman, Honorable Dr. Yuvraj Kale sir is a principal at Bhaumulak Ayurvedic Medical College, Nagpur. He is professor and HOD at the Department of Shalakya Tantra. He is having experience, 25 teaching experience. He is always one of the famous and dynamic and impressive personality, and hence he is a favorite faculty among the students. Published many research articles and in national and international journals. He has delivered lectures and speeches as a chairperson and guest of honor in national seminar and conferences. He is practicing in ophthalmology since 25 years. He has been serving society and needy poor peoples by arranging various free eye checkup, spec distributions, cataract surgery camps. He is famous for his social work. He worked as a sarpanch, and during his sarpanchship tenure, his village was awarded with Nirmal Gram President Award. Congratulations, sir. And also we have coordinator, co-chairman for this session, Dr. Praveen Chauhan, sir. He is a graduate of BMS, MS, and also he is working as a professor and HOD in the Department of Shalakya Tantra at Loknete Rajaram Bapu Patil Ayurvedic Medical College, Islampur, Sangli. I request to Dr. Manjari Keskar ma'am to deliver his lecture on the topic role of Ayurvedic Kriya-Kalpas in eye disorders. Dr. Manjari Keskar ma'am, please continue.
Thank you very much, sir, for the elaborative introduction, and thank you for giving me this opportunity to interact with all the Maharashtra people, as I many times miss Maharashtra, as I am away from Maharashtra now in Gujarat at Vadodara. So thank you for calling me from Maharashtra. So I feel like at home whenever I am there with Maharashtra people. So once again, thank you for giving me the opportunity to be there in somewhere where MOHS is related, and I'm glad for that, and I'm thankful and grateful to you and your principal, sir, for the same thing. The topic is role of Ayurvedic Kriya-Kalpas in eye disorders. Why this topic is nowadays, it is very important. Next, Kardije sir. Next. Whenever we put any medicine into the eyes, so the mode of administration of drugs, how we put it, okay, it can be topical instillation, it can be periocular injections, it can be intraocular injections, and lastly, but less common, it is systemic administration. Today we are talking about the next, sir. We will be talking about the topical installations, or what we can say. Topical installations, or what we can say, the Kriya-Kalpas. Kriya means the action, and Kalpanas, there are different modes of Kriya. So that is called as Kriya-Kalpana. In modern medicine, in ocular therapeutics, eye and lacrimal drainage system, as you know, that there is most of the drugs that we instill into the eyes, 80% goes into the systemic circulation through conjunctiva and the nasolacrimal duct, and only 10 or 20% is there for the corneal absorption, which matters a lot for all the ophthalmologists or shalakis. So that is very much important. Next. As I said, the routes of drug delivery in eye, they are topical, the first one, then the subconjunctival, another, as you all know, then we give it into the intrascleral route, then intravitreal, punctal route is also there. Anterior subtenons injections are also famous. Then suprachoroidal is also not that much practiced, but many times it is used. Then the posterior subtenons and subretinal, which the vitreoretinal surgeons are very much using the same thing. Next, sir. How how the factor, what are the factors that affects the absorption of drug in the body. Why I am telling you before going into the Kriya-Kalpas, because it is very much important for all of us, all the PG students, to know how whatever they do, whatever Kriya-Kalpas they take for their research purpose, how they act is it is very much important for them to know it. So the first thing is route of drug administration, how, through which route you are giving the drug. As if you are giving the drug through systemic, then as you know that there are so many structures in the eye which are avascular, so it may not be of much use. So route of administration is very much important. Then the solubility and bioavailability of drug is another important thing, important factor which affects the drug, ocular drug absorption. Solubility means, as you know, that corneal epithelium is lipophilic. So whatever you give, whatever you put through installation, or whatever route you are giving, how much it of the medicine will be absorbed through corneal epithelium. It will be more absorbed if it is lipophilic, less absorbed if it is hydrophilic. And the tissue contact time is also very much important. The more the tissue contact time, more will be the bioavailability of the drug. So that is again one of the important factor whenever you give the whenever the absorption of the ocular drug delivery is concerned. Then the physical state of the drug is also very much important. Especially this factor is more important whenever we deal with Kriya Kalpanas. So the physical state, how it is, I will explain it later. Then the time of absorption, as I said, that through the nasolacrimal drainage, the whatever we instill, it immediately goes into the nose. So how much time of absorption is there? So more is the tissue contact time, more will be the bioavailability, and more will be the absorption of the drug there. So all these factors need to be considered whenever you put anything into the eyes. And all these factors have been must have been taken into consideration by Sushruta or Charaka and Sharangdhar also whenever we see the mode of action of these drugs, of the Kriya Kalpanas. Then we get confirmation that all these factors must have been thought of by all these Lagutrai and Bruhatrais also. The absorbing surface and the excretion of drug, pharmacokinetics as well as pharmacodynamics. So these are the factors affecting the absorption of the drug in the body or in the especially in the ocular surface. Okay, so what is bioavailability? To be more precise, whenever we give anything intravenously, with the drug is 100% bioavailable. So with this example, students will know what is bioavailability. Okay, how much the drug is available for the for absorption, that is the bioavailability. Absorbing surface is determined largely by the route of drug administration. So for example, drugs absorb more rapidly from large surface areas like pulmonary epithelium. So whenever we deal with the asthma in modern medicine, we give the nasal sprays and all that, so that the absorbing surface should be more and the effect of the drug should be maximum. So here also, whenever we deal with the Kriya Kalpas, it is again very much important thing to deal with, to consider with. In Tarpana, tissue contact time is more, and nature of drug is both lipophilic and hydrophilic, because the medicated Ghruta is prepared through the aqueous decoction. So it has both the qualities. It is omniphilic and it gets absorbed more and more through the absorbing surface, that is cornea. So how the, as I said, the mechanism of ocular absorption, corneal and non-corneal. Non-corneal is non-productive. It's of no use for the, because it goes into the general circulation. And as you know, as I said earlier also, that there are so many structures in the eye which are avascular. So if it goes into the blood circulation, it will be of not much use for the ocular structures. But corneal absorption is very much important because the outer epithelium limiting barrier, pore size 60A, and only accesses small iconic and lipophilic molecules. So all this again whenever we give, we don't give Acha Sneha, or we don't give just Hima or Fanta. We always do Agni Samskara, so that more and more active principle should be there in the Kvata, and the particle size of the drug should be minimized so that it should get more and more absorbed. All these things are there. It should be kept in mind whenever we prepare any Kvata or Ghruta for the Kriya Kalpanas. So transcellular transport between corneal epithelium, which is lipophilic, and stroma, which is hydrophilic. As I said, cornea is omniphilic. So factors, what are these factors affecting bioavailability? That is inflow and outflow of the lacrimal fluids, efficient nasolacrimal drainage, then the interaction of drug with proteins of lacrimal fluid, dilution with tears, corneal barriers, and active ion transport at cornea. All these factors affect the bioavailability. The tissue contact time, bioavailability, and absorption, these are directly proportional to each other. So as I said, topical sarvesham akshiroganam adav ashtotanam hitam. So whenever any, even in the modern ophthalmology also, if the patient goes to ophthalmologist, what he prescribes are the drops. In the same way, even Ayurveda also says the same thing. Sarvesham akshiroganam adav ashtotanam hitam. So whenever you put, whenever the netrarogi comes to you, the first and foremost important thing is the medicine is through ashtotana, topical instillation. It can be aqueous solutions, it can be aqueous suspensions, oily solutions, for immediate action, and it gets diluted by tears. So the tissue contact time is very less in ashtotana. That is one more thing that you have to think of. Okay, and the topical instillation, which can be either it can be aqueous based or oil based. Oil based or eye ointments, they have more tissue contact time, so the bioavailability of the drug is more, so the absorption will be more. And again, as it is lipid, it has lipids there, so the corneal epithelium is lipophilic, and the more and more drug will be absorbed. But these side effects of the ointment are, it gives the blurry vision to the patient for some time. So many times we ask the patient to put the ointments at bedtime, and then we may ask the patient to do the ocular bandage also for more for better results. Intraocular penetration, again through cornea. Whenever we deal with the ocular absorption, drug absorption, we always think of cornea. And what are the drugs that are agents that reduce the surface tension, increase corneal wetting, and that ensures the maximum drug absorption. So it is again very much important which drug you are putting, whether sorry, whether it reduces the surface tension and allows maximum drug to penetrate, and then ultimately whether it is increasing the corneal wetting and ensuring the maximum corneal absorption. For example, in many of the eye drops, the benzalkonium chloride is there as a preservative, which is also act as a wetting agent and increases the drug absorption. But here, next, why we are more focusing nowadays on Kriya-Kalpas. The culprit is here. The main aim, I think, behind this webinar also is, and why we should go for Kriya-Kalpas, that it is worth remembering that preservatives in standard commercial preparations are themselves epitheliotoxic to conjunctiva and cornea if medications are used frequently. Benzalkonium chloride, as I said, is a wetting agent and it absorbs more, but it is epitheliotoxic among the preservatives. And this, I am not saying this, I am not claiming this. This is from Parsons Diseases of Eye on page 135. If you want to confirm, you can confirm. So what it says, it is worth remembering that preservatives in standard commercial preparations can themselves be epitheliotoxic to the conjunctiva and cornea if the medication is used frequently. So benzalkonium chloride is most epitheliotoxic among the preservatives. Povidone and chlorobutanol are better tolerated and therefore superior. So what is the need of the R is that the preservative-free eye drops are better alternative. So Ayurvedic preparations are more preferable, are more wanted nowadays to avoid this side effect. Okay, dry eye, for example, whenever we go to the patient, to the doctor, nowadays the prevalence of dry eye is very much more post-COVID especially. So what they do, I'm not blaming anyone. What they do, they give the lubricant eye drops. Dry eye is associated with chronic inflammation of the ocular surface, and both entities interchangeably have the cause and effect relationship in general. And if you cannot use these lubricant eye drops for more than 6 months, because it has some side effects also. As it has effects, it has some side effects also. To overcome these side effects, now it is the need of the hour. It is the need for the betterment of mankind to go for the Ayurvedic Kriya-Kalpas. So now we are moving towards the actual Kriya-Kalpas, which are they? Seka Ashtotanam Pindi Bidalas Tarpanam Tathaha Puta Pakonjanam Chaibihi Netraihi Kalpaihi Upachare. As you all know that Pindi and Bidalak has been added by Sharangdhara, and Sekashchotan, Tarpan, Putpak, and Anjana has been described by Sushruta also. Whenever we think of these Kriya Kalpas, the most important thing so that no one should blame our science is that the Vaidya should know, the Shalaki should know the avastha of the roga. If it is Nirama avastha, what to be done, and if it is Sama avastha, what to be done. So Seka, Ashtotan, Pindi and Bidalak are the Kriya Kalpas which one should use during Sama avastha. It is not me saying that, okay? It is this Sushruta gave the lakshanas of Sama and Nirama Netra Roga. For example, Netra Roga Sama Lakshana, what are they? Udirna Vedanam Netram, Raga Shofa Samanvitam, Gharshanisto the Shulashru, Yuktam Aman Nitam Viduru. So there is pain, there is Netra Lalima, there is Shofa, then there is a Gharshana, there is a difficulty in Unmesha Nimesha, and there is a Todavet Vedana, there is Shula, Ashru. All these are, if all these symptoms are there, then the Netra is said to be Sama. Okay, so whenever patient comes to you, whatever may be the disease, if these are the Lakshanas of the patient, then keep in mind that these are the Sama Lakshana, and what you have to do is to use either Sek, Ashtotan, Pindi or Bidala. Okay, so that is very much important for the Vaidya, for the Shalaki, for the Netra Visharat to know. Then for Nirama Lakshana, Manda Vedana Kandu, Sarambha Ashru Prashantataha. So the word Prashantataha is very much important here. All these Lakshanas are now relieved. Okay, then Prashasta Varna, Varnato Akshano, Sampakvam Doshamadishe. So all these Lakshanas are not there, and now only Manda Vedana is there. Then what you have to do, that you have to go for the Tarpan, Putpak as the Paschat Karma of Tarpan and Anjan. And one more important thing about this Kriya-Kalpas is that Sek, Ashtotan, Pindi and Bidalak are not supposed to use during Swasthavastha. But Tarpana and Anjana has been described to use in the Sadvrutta, in the Dinacharya also. So that is very much important. If we are not doing this, we are not observing the Sadvrutta or Dinacharya or Rutucharya, because of that, more and more patients are there who are having the eye disorders, as you all know that the eyes, nose and oral cavity are the things which are most exposed to the atmosphere. So the mucosa of these things are most exposed. That is why the prevalence rate of all these diseases are also more. And that is why Shalakit should be more vigilant and Shalakit should advise the patients and should educate the society to do the Sadvrutta Palana. It is very much important to go for the Tarpana. It is very much important to go for Anjana at least five once in 5 days or once in 8 days. Anjana, then Tarpana at least even you can hold it for 500 matra. It is said in the Samhitas also. And the most important thing is that it should be practiced and nasya, pratimarsha nasya. These things are there. Gandusha dharana. Each and every Kriya Kalpana, may it be related with Netra, may it be related with E.N.T. But if we follow it and if we educate the society to do it, it doesn't take much time. It doesn't take much cost also. It takes only 10 minutes of your valuable time out of 24 hours to be healthy, to stay healthy. And I think that is the aim of my today's lecture, that everyone should follow. And it should start, charity should begin at home, and it should start with Vaidya themselves. Sorry. So depending on the Kriya Kalpana or the Netra Sharira, if we go deep into it, then we can say that Mandala Patala and Sandhi, depending on these Kriya Kalpanas have been developed by our Bruhatrayi and Laghutrayi. For example, Shweta and Krishna Mandala Vyadhi, Sek and Ashchotana are very much important. They are used widely. For Vartma Mandala Vyadhi, Pindi and Bidalak are widely used. If you go into the details, then you will understand why I am saying this. And for Drushti Mandala, Tarpana and Puttapaka are used. Swastha and Sandhigat Roga, Anjana and Drushtima and Tarpana is again advised. So if you see the Panchabhautikatva of Netra, if you see whether the Roga Hadishthana is there, accordingly, if there is a Samavastha, then you have to go for say Kashchotan, Pindi or Bidala. And if there is Niramavastha, you have to go for Tarpana. Then Paschat Karma of Tarpana is Puttapaka and Anjana. And Tarpana and Anjana should be, again I am stressing that should be practiced in the daily life also, not in the not only for the Vyadhi Avastha. So moving ahead is the Seka. Seka, good tissue. Seka is having very good tissue contact time, because you directly put the Kwatha or the Siddha Dudha, whatever Siddha Dudha or whatever is there, Drava Dravya, you put directly into the eyes, that it ensures better tissue contact time, it ensures better bioavailability, and ultimately it ensures the better absorption. So, and patient is also very much happy with this, and the patient gets relief also immediately with the Sama Lakshana. So when we prepare, as I said, that whenever there is Agni Samskara, the molecular size reduces. That again ensures the better absorption through the cornea. pH can be adjusted depending on how much dilute we need, that how much the pH should be near about. The lacrimal fluid pH is 7.4, 7.2. So to match that pH, so that there should be no much irritation to the patient, we can adjust the pH also in Seka. And it can be repeated. It is said that you can do it as and when necessary also. And there are so many drug of choices. I will tell it in the next slides. Which drugs? Simple. There are simple drugs. It is not that up above the world you have to say to bring some bhasma or suvarna or something like that. It's not like that. These are the drugs which are readily available at very cheaper cost. So you can very well do these Kriya Kalpanas, reduce the Samavastha Lakshana. And once this speciality of Ayurveda is that it tells about the Apunarbhav Chikitsa also. So if whenever there is the Roga Shantata or disease, when the patient becomes disease free, we are not done. we, the Shalakis or the Ayurveda Vaidyas, are not done. We should advise the patient so that we should give them the advice so that there should be no punarabhava of the disease. So, apunarabhava chikitsa again is the speciality of Ayurvedic Vaidyas. Then the Ashtotana, as I said, Sarvesham Akshiroganam Adhav Ashtotanam Hitam. The matra here is very important because in Ashtotana, whenever we put the drops in modern, either 1 or 2 drops, not more than that. But here it is 8, 10 and 12 drops. If you have gone through the Samhitas, then the matra is either 8, Hina Matra, Madhyam Matra and Uttam Matra. So when we asked to madam, to the stalwarts, that how can the conjunctival pharmacist hold this much of drug there in the eye? So there's what Manjusha madam told me, that what you have to do is that you have to put the drops and keep it like that only, so that the drug should retain there in the eyes of the patient to ensure maximum tissue contact time. Again and again I am repeating the things, that the tissue contact time, bioavailability and absorption of the drug. So the more the absorption, more will be the results. So whenever we go for Ashtotana, always go for the classical matra, 8, 10 or 12 drops. Okay. So again, drug should be of your choice, whether there is a Vata Prakopa, Pitta Prakopa Lakshana, or Kapha Prakopa Lakshana, or Sannipatik Lakshana, or Dvidosha Lakshana, whatever. That the Vaidya should be well versed to know how much the visheshan of doshas are there and which drug should be used. Ashtotan can be repeated as much time as you want, depending on the severity of the disease. So it is again very much important in Samavastha. Pindi and Bidalaka, these are the Kriya-Kalpas which we should use especially in Vartmagata Rogas. The active principle of decided drug is absorbed through the skin. Okay, so through the stratum corneum layer of the lid. So the mechanical pressure also makes a difference. So that depending on ardhangula, 3/4 angula, these are said that how much thick should be the lepa. Okay, it should be like mukha lepa, pralepa, pradeha, like that. And depending on how much pressure it is exerting on the skin of the lid, that depends how much that it is up to the again to Vaidya to decide the thickness of the Pidalaka. But definitely Pindi and Pidalaka works very well in Vartmagata Rogas. Then the most popular, most famous Kriya Kalpana is Tarpana. Okay, Trupti, Ayam Truptikaram, Sreshtham Tarpanam, Netra Tarpanam. So it gives the utmost Trupti or utmost satisfaction to the eyes, and it allows Vaishatyam Varnapatanam, Samyak Trupti Lakar Lakshana, as you all know that. But again, as I said, that whenever you go for Tarpana, you should know that now there is Niramavastha of the disease. If you do it in Samavastha, the Lakshana will increase and the patient will say that Tarpan se to kuch hua nahi. But it is not the fault of Tarpana. It is the fault of the Vaidya to understand, to diagnose the Samavastha or Niramavastha. It should be, Tarpana should be done only when there is Niramavastha. The Vyadi should be Prashantaya, as I said earlier also. So that is very much important for the Shalaki to know when to do the Tarpana. It is not like that. Again, it is not like that the Roga is Shanta and you immediately go for Tarpana. It is said that Samshuddha Shirasa Dehe. What does it mean? That before doing the Tarpana is a Prasadana Chikitsa. So, जैसे हम पहले चेहरा धोते हैं, उसके बाद में फाउंडेशन लगाते हैं या उसके बाद में कुछ मेकअप करते हैं, in the same way, before doing the prasadana of netra, the whole body should be cleaned up. The samshuddha dehe shirasa. Deha bhi samshuddha karna hai, depending on which prakriti patient is having. Most of the times we don't do vamana in netra roga, but virechana is highly indicated. And after that, you can go for basti also, because whenever there are diseases in the eye, it is not like that it only affects the anterior segment. When it is the disease in there in the posterior segment, you should go for basti also. And after that, tarpana is advised. You will say, who is having this much of time? But see, when health is lost, everything is lost. So it's better that you don't go for the outing. You take 8 to 10 days leave, and depending on the rutu and your prakriti and agni and all that, Vaidya will decide how much time it will take for you to do the Samshuddha Shirasa Dehe, and then you go for Tarpana. It is must for you all, for everyone, as we are using the gadgets nowadays at extreme level. So it is very much important for us to take very good care of our eyes, because sarvendriyanam nayanam pradhanam. So if all our sense organs are gone out of order, then we will be boycotted from the society. So it's at most important for all of us to take good care of eyes, including Vaidyas also. So if the Chalakis are not doing, there are so many people in Maharashtra who are there on the microscope doing surgeries very nicely. That's so nice of them. But all of them also should take very good care of their eyes, because प्रत्यतः क्षण ही है, या फिर नेत्र रोग के लक्षण में ये भी बताया गया है कि एक साथ किसी एक तरफ
Hello. Looks like there was some problem at the end of the speaker.
Yes, sorry. There
Madam,
is,
carry on.
yeah. So I was at Tarpana, and I was requesting all the best surgeons at Maharashtra especially, and all over India and all over world also, because everyone is doing the best job, but they should take very good care of their eyes, and they should take good care of their accommodation and the ciliary muscle also. And for that, this Tarpana is blessing for all of us and for all the patients, so that if the netra is trupta, netra is prasadita, then the vyadhi will not occur again. So it is very much important. And why it is more, it is very much popular. If the nirama was there, then definitely more, the as the corneal epithelium will take more and more grita, it will absorb. Tissue contact time is also more, depending on the vyadhi and the adhisthana also. The when the gambhir adhisthana is there, then the dharankal is also increased. For swasthavastha, it is 500 matra. It takes hardly 5 minutes. Okay, nowadays, I'm proud that we at Parul University, we have developed the Netra Tarpana device, which is having the lead also, so that even the patient himself can put the Tarpana Ghruta, he can sleep, and then after 10 minutes or 15 minutes, whatever is there, he or she can take out that goggle, that device, and because of that lead, it will not leak from anywhere, and again the patient can take out that Ghruta and use it again for next day at his or her convenience, as all the people are very busy nowadays. So Sadhya Virachan ke baad mein ye hum kar sakte hai, and we have even filed the patent for that also, and provisional patent hame mil bhi gaya hai. So again, I hope in next 1 year it will be available at all the counters, and everyone can use it at his or her convenience. So Tarpana, as I said, Tarpana is omniphilic. The Ghruta is lipophilic also, but the procedure that we prepare Ghruta with Kvatha, so the hydrophilic and lipophilic, both the qualities are there in Ghruta. And as it is omniphilic, as it is, it has the omni nature, so it gets absorbed more and more. But all that is important for Vaidya, for a Shalaki to understand the avastha of the disease, of avastha of the netra. It should be Nirama avastha especially. Next. Again, tissue contact time, bioavailability, and the drug absorption. All these are directly proportional to each other. All that the Tarpana has a side effect is that it causes the blurring of vision, and of because there is a layer there, lipid layer in front of the eyes. At Sridharyam, what they do, they ask the patient to sleep. Sleep means to lie down, and then they put the bandage with the flower on the eye. That gives very nice feeling to the patient, and again that will help the layer to disappear in 10 minutes, and then patient can go to their routine work. Tarpana is oil in water emulsion, which is more famous and which is more.
आज करा के रखते बोलना फिर कल आओ बोल क्या करेंगे.
Tarpana, as I said, is preventive as well as curative in action. So to stop the progression of disease, free radicals and toxins need to be removed by Samshodhana, as I said, Samshuddha Shirasadehe, and then Shamana Chikitsa or Prasadana Chikitsa, it should be done. Then we will go to the Sadvrutta Palana, sir. Yeah. As I said, that Tarpana and Anjana are practiced in Swastha too. So this is the speciality of Ayurveda. This is the speciality Swasthasya Swastha Rakshanam, then Aturasya Parimanukshaha. So if you go for Tarpana and Anjana as prescribed by Sushruta in the daily regime or daily schedule, then there will be no eye diseases, and we can maintain good eyesight for a longer time, for a longer period. Anjana is must to do once in either in 5 days or 7 days. Whether a Srotanjana, it should be done every day. But nowadays, meanwhile, we used to do it. We used to put kajal in the eyes of the kids. But in the meantime, something happened, something went wrong, and the practice vanished. But now it is the duty of again Shalakis to practice it, to ask the patient, to ask the society, those who come to their clinics, that they should put the Saviranjana, Anjana every day in the eyes. Rasanjana either once in 5 days or once in 7 days. Simple exercise. If you wake up early, you can look at the another retina that comes in the sky, that is called as sun. Okay, it's just like our retina, and that retinal glow is just like the rising sun. So you have to go. You can do Trataka for 3 minutes. If you do that, that will increase the strength of your eyes. And the palming exercise after Trataka, you can go for palming exercise. It hardly takes, again I am telling you, it hardly takes 10 minutes for you to do all these things. So 10 minutes out of 24 hours. So if you calculate, it's not more than 2% of your time, valuable time, to protect your eyes and protect your sense organs. Puttapaka, as I said, that Puttapaka is done after as a Paschat Karma of Tarpana to avoid the Gaurava. But many times what happens, Puttapaka is colorful. As Ghruta, it is not colorless. So many times patient is not comfortable, but still you can ask the patient, you first convince the patient that it will be like that only. And the Dharan Kal may be 3 minutes or something like that to avoid the Gaurava. And the patient must do that. but patient can't do it at his or her own place. So it is we that we have to do it at our clinics. Then what is more important is Anjana. Why I am saying Anjana? Anjana, the निरुक्ति और व्युत्पत्ति ऑफ अंजना इज अनक्ति अनेन इति अंजनम. इतना अच्छा दिया है. क्लेदनम, नेत्र को सबसे भय किससे है? नेत्र को सबसे बड़ा भय है क्लेद से. कफ जो जब प्रकोपित हो जाएगा या फिर विगुण हो जाएगा, देन इट प्रोड्यूसेस क्लेद, एंड दैट इज मोर dangerous for the netra. So अगर आपको वहां क्लेद नहीं चाहिए, if you don't want clay there in the netra, one thing that you must do is anjana. So anjana is again the thing which our Bruhatra is thought thousands of years ago as a nanoparticle. So the more you do the gharshana, then the more the molecular size will reduce and very less quantity of anjana will be needed. So all that you have to take good care of the infection. Matlab, aseptic antiseptic precautions should be taken while preparing the anjana. If you put it either in once in 5 days or once in 7 days, and you allow the strava to come up, then there will be no clay and the eyes will be clean as the diamond. And so this is again the same concept of nanoparticles also, and cleaning the eyes. Here also, because of the nanoparticles, the tissue contact time is more. It is there in the fornix, it remains there in the fornix, and the tissue contact time is more, so the bioavailability and so is the drug absorption will be more. So commonly used, what are the drugs? As I said, that there are some drugs which we should use. It costs nothing. There are Ghruta. Ghruta, as I said, I will tell you, Ghruta is the first line of treatment for any disease. अग्नि की चिकित्सा करनी है, क्योंकि कुछ भी होता है, then we think of अग्नि. First जठराग्नि, then धात्वाग्नि, then पंचभूताग्नि. So first we go for जठराग्नि. So अगर अग्नि की चिकित्सा करनी है, Ghruta is must. अब आप बोलोगे, most of the so-called modern people will say that it will increase the lipids, but no. I will tell you one research. Okay, a clinical study on effect of medicated ghee on serum lipid levels demonstrated hypolipidemia effects of ghee when given in high dosages. There was an 8.3% decrease in serum total lipids. 26.6% decrease in serum triglycerides, 17.8% decrease in serum phospholipids, and 15.8% decrease in serum cholesterol esters. So whenever you go for any kaya chikitsa, the Shalaki should be very good kaya chikitsak also, as per my personal opinion, because whenever you go for any netra chikitsa or mukha nasa karana gala chikitsa, agni is to be is a must thing to think of, because rasamala is kapha and netra is having the bhaya from kapha, and the urdhva jatrugat part is again kapha pradhanya is there. So whenever you go for any chikitsa, it is also said that akshi kukshi bhava rogaha pratishaya vrana jwaraha panchaite pancharatrena rogaha nashyanti langana. How many of we follow this? If you go, langana doesn't mean fasting. Langana means laghu ahara. 1/4 of your hunger. You should take that much of food, and it will be called as langana. Langana is not fasting. Langana is not taking sabudana. Langana is not taking shengdana or having some custards and all that. Sorry to say, but langana is having food of 1/4 of your capacity. Okay, and especially at night time, because the metabolic rate is very slow at night. So if you do this much of thing, and if in the early in the morning, if you take 10 grams of ghrita with warm water, it will be just the Agni Deepan Chikitsa, and you will be fit and fine within 5 days. Take it from me. I do practice it every day. So The Grita lowers prostaglandin levels, which are inflammatory mediators. Ghee shows hepatoprotective effects also. It is anticonvulsant activity is also established. Then its effects on enhancement of memory and enhancement of wound healing is also there. So what is there in taking Grita? In asking the patient to take Grita, it will also help in the increasing your eyesight, and it will increase your Agni. It will help to establish the Agni in good in balanced state. So what does it take on? So nothing, and it doesn't increase your lipid levels also. So the study is saying, that is the IU journal is telling it. Okay, then the Ghruta and the Madhu. सर्वाण्येवच अभिनवान अन्यत्र मधुघृत गुड़ पिप्पली विडंगे भ्याह. सब कुछ नया लेना है, छोड़ के किसे? मधु, घृत, गुड़, पिप्पली और विडंग. ये 5 चीजें जो है वो पुरानी लेनी है. पुराने लिए बहुत अच्छा, ना मिले तो तैयार ही ले लो, पर लेना जरूर एंड यूज इट विदाउट एनी हेजिटेशन. ओके. हनी का जो रेफरेंस मिलता है 8000 ईयर्स से भी पहले से मिलता है. पंचामृत में क्या है? आप में से कितने लोग, अगर हम सो कॉल्ड ये सोफिस्टिकेटेड ब्रेकफास्ट लेने से अगर 1 ग्लास हम पंचामृत लेते हैं, then also it is more, that will keep you healthy for next minimum 20 years. I'm telling you. So I also do practice it. So that is very much important for all of you to practice these small things which has no cost. पर हमें क्या है कि महंगा है, तो जैसे वो क्या बोले, वो हरिद्रा का वो दूध आता है आजकल, उसको गोल्डन मिल्क बोलते हैं. सो वो अगर पैक्ड मिलेगा तो हम ले लेंगे, पर घर में माँ ने बोला कि 1 गिलास दूध में 1 चम्मच हल्दी डाल के लो, तो हमें वो डाउन मार्केट लगता है, पर ऐसा नहीं है. ओके. सो देयर आर सो मेनी थिंग्स विच आर अवेलेबल रेडीली एट नो कॉस्ट, but we have to practice that. Ghruta is one, and then the honey is there. Honey has been reported to have inhibitory effect on around 60 species of bacteria, some species of fungi and viruses. Honey contains flavonoids, phenolic acid, ascorbic acid, peptides, etc. Most of these compounds work together to provide a synergistic antioxidant effect. So all these things are in one bottle of honey. Then why not to take this? And if you mix honey and ghruta in asamana matra and take it in the morning and take panchamruta for breakfast, then you will live longer. But we don't do that because we feel it's down market. Then another thing is that anjana adi gana, the name itself tells कि इसमें कौन आता है? अंजना, रसांजना, नाग पुष्प, प्रियंगु, नीलोत्पल. ओके. केशराणी, मधुकम चैती. कौन कौन है? अंजन या फिर सौविरंजन है, सल्फाइड ऑफ lead. रसांजन which we prepare through the दारू हरिद्रा घना. देन नागकेशर, प्रियंगु, नीलकमल, उशीर, कमल केशर और यष्टि मधु. इसमें से रसांजन तो हमें मिलता ही है, एंड यष्टि मधु, नीलकमल, उशीर, all the प्रियंगु, all these are very readily available. Then why not go for this and do anjana once? If you don't have that, put madhu, at least 1 drop madhu for once in 5 days, and it will not allow any clay there in your eyes. Then there is the utpala adigana. Utpala, as you all know, is kamala. It is daha pitta rakta vinashana. If any pitta prakopa lakshana is there, you go for utpala adigana. Then parushaka adigana, that is best vata shamak. If you find any vata vitiation there in the eyes, you take any drug from this parushaka, draksha, katphala, dadi, maraja, dana, kataki phala and triphala. All these are again readily available. So why not go for that? Then mustadigana for kafanashana. What does it contains? Musta, daru, haridra, haritaki, amalaki, bibitaki, kushtha, vacha, patha and katuki. So again all these are, so if vata visheshan is there, go for parushadi. Then if pitta is there, pitta prakopaka is there, then go for utpaladi. And if kapha prakopa is there, go for mustadi. What's the big deal? Everything is easily available. Then त्रिफला, as you all know, वो तो चक्षुष गण में ही, चक्षुष ही है त्रिफलादि गण. You go for that, it is easily available. अमलक्यादि गण, one more गण is there, that अमल की हरितकी पिप्पली चित्रक, ये चक्षुष है. पित्तग्न सब काम करता है. कफ और पित्तग्न है, क्यों नहीं जाना है? What is the big deal in going for something very costly? Why not go for all these things which are readily available? Why not go for Madhu Anjana, Ghruta Madhu Anjana? We are working on Ghruta Madhu Anjana in diabetic retinopathy, and I'm sure we will get very good results here. Next, sir. So now we are coming to the conclusion. No, one more slide. Yeah. So the magical thing is that our Acharya knows about earlier mentioned pharmacokinetics and pharmacodynamics of drugs. They know about bioavailability. They know about tissue contact time. They know about the corneal layers and their affinity towards lipids also, and towards the towards the hydrogen molecule also. They are hydrophilic. Which one is hydrophilic? Which one is lipophilic? How much should be the tissue contact time? In which stage, which Kriya-Kalpa is to be used? When Tarpana should not be used? What are the indications? What are the contraindications? Everything is in detail there. All that we need is to read with open eyes, and in between the lines, each and everything is given there. All we need is have the Videya Paramadaraha. Ayurveda Upadesheshu Videya Paramadaraha. First, we should have utmost faith in what has been written. Why I told you that the drug absorption and all that and tissue contact time, because unless I tell that, no one will believe that the Kriya Kalpanas, even they know that eyes have some structures which are avascular. So then we have to do something local there. Blood circulation is not there for many things, and so and that is why they developed the Kriya Kalpanas. They must have, and even if you go for all these Gana, now also it is proven as per the modern science also. All these have the same actions as described by Charaka and Sushruta thousands of years ago. So everything is there in the Samhitas. All that is needed is to follow it and see the action of all the drugs. I have given only 5-7 Gana. There are so many Ganas, and there are so many things that you can go for. Just try Ghruta Madhu Anjana, and try Panchamruta. Try Langana if the Lakshana Visheshan of doshas are there. So many small things are there. All that we need is to follow it. Thank you very much. Thank you for giving me the opportunity. I hope I am in time.
Thank you so much, ma'am. Very important session you have delivered. You have given importance of Kriya-Kalpas, also details the factors affecting the absorption of drug in the body. You have also explained the Kriya-Kalpana that you can be used in a common use, including our Vedas, and also for the that public also, we can say. Yes, thank you so much, ma'am. Now I request to Dr. Yuvraj Kale sir, Principal Bhaumulak Ayurvedic College, Nagpur, Chairman of this session, to give an expert comment for this session. Dr. Yuvraj Kale sir, please.
थैंक यू सर. नमस्कार. सर्वप्रथम मैं धन्वंतरी आयुर्वेद कॉलेज उदगीर और वहाँ के प्राचार्य श्री दत्ता पाटिल सर, इनका हमें जो ये सम्मान दिया है चेयरपर्सन करके, उसके लिए सर्वप्रथम बहुत आभारी हूँ. साथ में ही हमारे कोऑर्डिनेटर धाटे सर, इनका भी आभारी हूँ, और को चेयरपर्सन डॉक्टर चौहान सर, और आज के स्पीकर डॉक्टर मंजिरी केसकर मैडम. तो तो आज का जो मैडम का संबोधन था बहुत ही अच्छा था। मैडम ने शुरुआत की मोड्स ऑफ इंस्टॉलेशन से, मोड ऑफ इंस्टॉलेशन से लेकर तो एडमिनिस्ट्रेशन से वहां तक फिर अपने आयुर्वेद क्रियाकल्प की तरफ मैडम आए। आज के दिन में मैं देख रहा हूं कि महाराष्ट्र में जो भी हमारे ऑप्थेल्मोलॉजी से नेत्ररोग तज्ञ बन रहे हैं, सभी लोग सर्जरी की तरफ बहुत ज्यादा जा रहे हैं। लेकिन जो आयुर्वेद नेत्रों का या शालक्य का जो मूलभूत है, जो क्रियाकल्प, उसकी तरफ जितना ध्यान जाना चाहिए उतना ध्यान आज के तारीख में भी नहीं जा रहा है। मैं पिछले 25 साल से प्रैक्टिस कर रहा हूँ ऑप्थेल्मोलॉजी की, और मैं देख रहा हूँ कि आज की जो सबसे बड़ी बीमारी है सीवीएस कंप्यूटर विजन सिंड्रोम, जो मैक्सिमम पॉपुलेशन हमारा यंग पॉपुलेशन है कंप्यूटर के पीछे पड़ा हुआ है, मोबाइल के पीछे पड़ा हुआ है। तो उसमें मैं खुद तर्पण कर रहा हूँ और तर्पण के रिजल्ट भी काफी अच्छा रहे। जैसा कि मैडम ने कहा कि ये टाइमिंग है, टाइम ज्यादा लगता है, पेशेंट्स के पास टाइम नहीं है, लेकिन जब रिजल्ट आना चालू हो जाएगा तब ये अपना जो प्रॉब्लम है सॉल्व हो जाएगा। आज के मैडम के इसमें मैं इतना ही बताना चाहूंगा कि बाकी तो सब बहुत ही अच्छा था, लेकिन जैसा कि हमारा टॉपिक था रोल ऑफ आयुर्वेदिक क्रियाकल्पस इन आई डिसऑर्डर्स, आज के इसमें लोगों को क्या प्रैक्टिकल चाहिए। आई डिसऑर्डर्स, एक दो आई डिसऑर्डर के साथ उसका क्रियाकल्प का उसका उपयोग यहाँ हुआ, केस स्टडी अगर होती तो बहुत ही अच्छा होता। नेक्स्ट टाइम इस बात का ध्यान रखेंगे। बाकी ओवरऑल बहुत अच्छा हुआ। फिर से एक बार आप सभी का धन्यवाद करता हूँ। थैंक यू।
Thank you, sir. Thank you so much for your expert comment. Now I request to Dr. Praveen Chavan, sir, co-chairman of this session. Please give your expert comments on this session.
Good afternoon, everyone. The session was very informative, explained by Madam. All things in details, especially bioavailability, contact time of drug absorption, and also importance of Tarpan. Madam explained very well with the clinical application in day-to-day practice. This is very helpful for our PG students and Shalakya practitioners. Many thanks for the organizing committee, coordinator Dr. Rajendra Date sir, and also thanks to Dr. Dattadray Patil sir for giving me this opportunity. Thank you.
Thank you, Chavan sir, for your expert comments. Thank you, Dr. Manjari Keskar ma'am. Thank you, Dr. Yuvraj Kale sir. Thank you, Dr. Praveen sir, for attending this seminar and for guiding to us all the participants. I also welcome all the just joined all the participants, MHS and MCM coordinators. Also, they are welcomed in this webinar. Now, I declared with the help of chairman, this session is over. First session. Now we are going to start second session. The topic
Thank
of
you
this.
very much, sir.
Yes, ma'am. Yes, ma'am.
Thank you
Yes.
very much. Thank you very much.
Thank you, ma'am. Thank you. Thank you so much. Now we are going to start second session. The topic of this session is a comprehensive approach towards ENT disorders with special reference to tinnitus management with Ayurveda. For this session, we have eminent speaker, Honorable Dr. Sunita Magar, IMT Ayurved College, Kharghar. Chairman of this session is Dr. Khan sir, Professor, Government Ayurvedic College, Nanded. And the coordinator is Dr. Ravi Patil sir, Professor, Dhanvantari Ayurved College, Udgir. I request to Dr. Ravi Patil sir to continue this session. Thank you so much. Dr. Ravi Patil sir. Coordinator of this session is Dr. Ravi Patil sir.
Sir, please unmute yourself.
Yes.
Dr. Ravi Patil sir.
Yes, sir. Hello.
सर 2 डिव्हाइसेस जवळ आहेत, एका डिव्हाइस पासून लांब राहा.
Okay, sir. Hello. Are you audible, sir? Hello.
Yes, you are audible.
Thank you, Date sir. Hello. Yes. Welcome to all respected delegates. I think all are came. I, Dr. Ravikant Patil, Professor Shalakya Tantra, Dhanvantari Ayurved Medical College, Udgir, and coordinator for today's second session of this national webinar. With the blessings of Lord Dhanvantari, firstly, I am grateful to our institution and our principal, Sir Dr. Datta Patil, sir, for allowing us to this national webinar on Ayurvedic Kriya-Kalpas in the management of eye and E.N.T disorders. This year theme is all we are know, Hamara Ayush, Hamara Swasthya and Ayurveda for nutrition, which is this program will endorsed and affiliated by MHS Nashik and MCIM Mumbai. Okay, ma'am, today's firstly I'm before we going to start, I would like to introduce all delegates, including our speaker ma'am, chairman sir, and co-chairman sir. Okay, our today's eminent speakers ma'am's name is Dr. Sunita Magar ma'am, presently working in Eye Medical College, Kharghar at Navi Mumbai. I will briefly introduce her. We are very lucky to having ma'am for today's speech. That is, ma'am is a gold medalist in 1991 in her UG and silver medal awarded with silver medal in Rashastra and Bhaishajya Kalpana subjects. Ma'am's teaching experience is about 22 years. And her area of specialization is that is noise induced pollution, allergic rhinitis, migraine, sensorineural deafness for quality like this, etc., etc. Also, ma'am is attached with Charak Pharmaceutical as a quality control in quality control methods. Madam's publications are about 20 research articles in national and international conferences. Ma'am also been board of study member in Datta Meghe University, Varda, and attended a various seminars, ROTP, and paper presentation in national and international levels. Okay. We have today the eminent chairman, sir, that is Dr. Khan, sir, Khan Nisar Ali Zafar Ali, sir. Presently, they are working.
Hello, good afternoon, everybody.
Good afternoon, sir. Presently, Khan sir working as a associate professor in Government Ayurvedic College, Nanded, and also they are HOD at Nanded College. Sir's teaching experience is very wide. That is 32 years since they are teaching in Government College. And since 20 years they are teaching to PG students. PG medical statistics since 15 years. Sir is a member of IEC since 12 years and published their research articles about 12 in numbers in various national and international conferences. Sir also awarded with Corona Yodha by district collector for active participation in COVID-19 pandemic last year as a coordinator in COVID center as a coordinator. Also, sir, resource person in various national seminars, ROTP and workshops also. Thank you, Khan sir. Today's our co-chairman, sir, is Dr. Milind Gore, sir, which is working in as associate professor in Srimati KG Mittal Ayurvedic College, Mumbai. Sir, yes, good afternoon, sir. Since 18 years, sir, teaching approximately 18 years experience I have had teaching experience, sir. As a resource person in Ayush CME also, Their research papers are 4 in international conferences and 1 in national conferences. Paper presentation are about 5 to 6. Sir is a guide for research project for students under MUHS and awarded as a late Pramila Tai Kanade Young Scientist Award and National Best Teacher Award in Shalakya Tantra in 16th August and 2022. Very much thank you, sir. Training, sir had training of phacoemulsification, cataract surgery, and subject expert in internal ethical committees, various internal ethical committees. So these are our speakers, chairman and co-chairman, sir. Today, with the permission of the chairman, sir, and co-chairman, sir, I would like to invite today's eminent speaker, Dr. Sunita Magar ma'am, to address this session. And today's topic is a comprehensive approach towards ENT disorders with special reference to tinnitus, that is management in with Ayurveda. Thank you, ma'am.
Hello, good afternoon, everybody. Good afternoon to respected senior teachers who are seated, Khan sir and all, Gore sir and this principal of this Dhanvantari Ayurvedic Medical College. Recently, Dr. Manjari Keskar has delivered a very eminent lecture. Am I audible, sir?
Yes, yes, you are
Yes,
audible.
madam.
My voice is clear. Yes.
Yes,
So everybody is known to us. So since we belong the same fraternity, so I would like to thank first of all organizers Department of Shalakya Tantra and Principal sir for inviting me to deliver this lecture, particularly this comprehensive approach towards ENT disorders in special reference with the tinnitus, right? So I would ask the organizers whether they will share the screen or I will have to go for it.
Madam, you can share the screen.
Okay, give me 5 minutes. Then it's okay. Is it visible now?
Yes, ma'am. It
Screen
is
is
started screen sharing.
started screen sharing. Yes.
Yes, ma'am. It is visible.
Magnify ka hota hai. Yes. Yeah. So today's topic I already told you yesterday only. I got an invitation that I should speak in this particular topic. But let me tell you one thing. My intention is to not only speak on Kriya-Kalpa, though the topic is revolving around Kriya-Kalpa, but I would like to emphasize and focus more on tinnitus, particularly because it is a very critical issues nowadays, deafness and this tinnitus, because both the disease goes hand in hand, as all of you know. So I would speak about tinnitus, and apart from the Karna Purana and Karna Dhupana, there are only 2 to 3 Kriya-Kalpas which we can apply in this particular ear, nose, throat diseases, because unlike ophthalmology, like madam just already spoke, Manjari Keskar madam, that about Tarpana, Ashtotana and pharmacodynamics and kinetics. So I would always wanted that there should be certain kind of procedures or drops, whatever. So today's topic, I would start with this tinnitus. Or tinnitus, I would like to cure it holistically. And tinnitus is a very annoying to the patient. And nowadays, so many patients are reported to IMT Ayurvedic Medical College. I have started audiometry unit here. First, I go for audiometry, I find the problem. And then apart from sensorineural deafness, tinnitus is also on high rise. So this is the actual picture. Patient is unbearable and annoying. So ancient treatment modalities, all of you know that Nasya and Karna Purana and Karna Dhupana. As we are all being Shalakis, we all knows what are the Kriya-Kalpa we are adapting to particular to cure these diseases. But today, I would like to focus more comprehensive. I word the word comprehensive. That means I would like to cover both the modern and Ayurveda description about tinnitus, because my UG students are also listening to this particular seminar, and how unimaginable and how unbearable this annoying noise is that we called as a tinnitus. So first of all, this few slides I would like to share with you for my UG students and undergraduate and PG students, that this is anatomy of the particular ear structure, and as this disease is revolved around this physiology of hearing, because mechanism of hearing gets impaired, right? Though there are n number of ear, nose, throat diseases, here specifically I would like to focus on tinnitus, ringing in ear, and deafness issue, right? So physiology of hearing, all of we know that how the sound waves are collected, strikes on tympanic membrane, and then further into the middle ear, and through the ossicular chain, stapes, incus, and all these three small bony chains, how that it transmitted to the oval window, and vibration of stapes footplate causes pressure and changes labyrinthine fluid changes, and causes organ of corti stimulated, basilar hair cells are also stimulated, and convert this particular mechanical energy into electrical energy. Initially it is a mechanical energy, and that it will convert it into the electrical impulse. As this much kind of knowledge that I would like to share for my UG and PG students who are listening me. So this kind of physiology of hearing, impulses carried by auditory nerves and goes to hearing center in temporal lobe. So this is the physiology
Excuse
or
me,
mechanism.
madam.
Yes.
Madam, slides are not changing. Can you stop sharing and reshare again?
Slides are not changing.
Means title slide is only visible.
Okay, what is tinnitus now? Not visible?
No.
It is RS.
Yes.
Yes, it is visible
Now?
now. Yeah.
Are
Prevalence of tinnitus.
prevalence. तिकडे जायचंय मागे. This one, unimaginable and unbearable.
Yes, it is visible.
Yeah, so I was talking about this previous slide. So let me explain again how annoying and unimaginable and unbearable this voice is. And for that, as my UG student and PG students are listening and watching to this, they should know what is the mechanism of hearing and how the mechanical energy in terms of sound waves, when it goes to the organ of corti, basilar hair cells, and reaches to the auditory nerve, how this mechanical impulse this converted into the electrical impulse. Now it is visible, this slide?
Yes, ma'am.
Pinna. So physiology of hearing, collection of sound, and then collection of sound के बाद उसके बाद each and every one I will have to take. Ossicular chain, it goes to the ossicular chain, transmitted to oval window, vibration of stapes or middle ear bone, footplate causes the pressure, changes occur into the labyrinthine fluid, and thereby this causes movement into the basilar membrane, where hair cells, basilar hair cells are these tiny hair cells are there, ones which are destroyed, that because of the destruction of these tiny hair cells which are there in the basilar membrane, so it causes the sensorineural deafness as well as the tinnitus. As I already told you, both the disease goes hand in hand. So organ of, then it reaches to the organ of corti and convert this mechanical energy into the electrical impulse. So now it is visible side, impulses are carried by auditory nerve.
Yes, ma'am. Can you put it into slideshow mode? Okay. So just on click, it will
now
be. Yes,
it is visible, physiology of hearing.
Yes.
So once all this physiological hearing is over, so definition of tinnitus, I would more focus on tinnitus because there are very few Kriya-Kalpas as far as the ENT disorders are concerned. So definition of tinnitus already knows the noise inside a person's head in the absence of auditory stimulation. There is no stimuli outside, still person himself hears the voice. That is called tinnitus. It is not audible to others, but the person himself hears the voice. So tinnitus is not a disease, but a condition that can result from a wide range of underlying causes. And this is a less addressed issue. There are a number of ENT surgeons in the Kharghar or periphery. They are referring these tinnitus cases to and sensorineural deafness cases to me. They said that that is the end point of their pathy, and it's now high time that we should take the challenge. And I have given this topic to my PG scholar, sensorineural deafness, particularly with the Karna Purana, that kind of topic given. Then I have started audiometry, and our unit is running well. So tinnitus is, what is tinnitus? Is the perception of sound in the absence of any external input. The perception is unrelated to any external source. Symptoms can be unilateral, it can be bilateral, it present with or without hearing loss, sometimes only tinnitus, sometimes with the or without hearing loss. And resemblance, ringing, hissing, whistling, humming, buzzing, chirping, or clicking. There are n number of sound patient used to describe in their own languages. So see the prevalence of this tinnitus. The data is from July 2016. So, but now the prevalence is high. Now 8% to 25% alone in US population, right? US and UK, this disease is very high. Tinnitus and sensorineural deafness. In India, also 4.6 to 30% of tinnitus in other countries. So prevalence is high. That's why this deafness issue is included in the National Program for Control of Deafness. And as previously as there was National Program for Control of Blindness nowadays, but the issues are remain unaddressed. Because in my n number of videos, I already told, keep patient easily accept that there is some difficulty in visualizing, in seeing the object, but as far as the listening or hearing aspect is concerned, patient is always denial mode, or wo patient bolta hai that here deafness is noticed by others, whereas the diminished of vision noticed by the person himself. So nobody come forward to take the treatment at the initial state unless and until patient goes into the profound hearing loss. That is my observation since my 30 years of clinical practice. I would like to correct it, sir said 22 years, but it is a 28 years of clinical practice. So symptoms of causes, although tinnitus is often considered idiopathic, the most likely causes can be determined from the case history and patient symptoms. Age-related hearing loss, as all of us know, presbyocusis, less presbyopia, noise exposure stay. So just now in back, I have presented paper on this noise-induced pollution due to occupational health hazards. The person who are working in the welding or in pharmaceuticals, or there are n number of industries where there is a noise pollution is more than 85 decimal. And if there is an exposure to more than 40 decimals or 85 decimals, then there will be the deterioration occur into the cochlear nerve. So non-pulsatile tinnitus, symptoms and causes. इसके बाद fact. So long back, it is a very old slide. Tinnitus को बोला जाता था कि something worm is in the inside, acoustic hallucination. अरे ये तो तुम्हारा भ्रम है. ऐसा तो कुछ होता ही नहीं है. ऐसा कुछ आवाज वगैरह नहीं आता. It's just merely hallucination of the patient. Bewitched ear, right? Treatment remedies for tinnitus date back to the era of Aristotle, who proposed masking tinnitus with an external stimulus as remedy. See, what was the remedy in the ancient era? That in just divert the patient's attention towards the external stimuli, external noise, so that he or she cannot listen to the internal noise, what we call as a tinnitus. So types of tinnitus is subjective or objective, as in some cases other can perceive in actual sound coming from the person's ear. There is very few cases where the other person who can listen the voice, what is been heard by the patient. And is subjective, the most common cause is noise-induced hearing loss. Other cause include ototoxic drug and drug withdrawal. All of we know that in all the cases, I would particularly speak on sensorineural deafness, tinnitus, and thereby we will see what kind of Karna Purana and that kind of remedies are useful and fruitful. And I am practicing also. So sound injuries to the cochlear nerve. Normal conversation, we would like to focus that what is the normal conversation in terms of dB. So normal conversation is about 60 dB. Sound at or below 70 dB generally considered safe. But any sound more than 85 dB is most likely to damage your hearing over the term. The sound below the 70, I would say sound below the 45. We should keep the sound below the 45 dB. considered as a safe. But that also, if the sound below the 40 dB, but the duration is more than 4 hours, like where our screen timing is more than 4 hours, the blue light is retinotoxin. In the same way, this particular noise who is crossing the limit, though it is up to 40 D or more than 40 D, if exposure is more than 4 hours, then definitely it will damage the cochlear nerve. So out of ENT disorders, deafness and tinnitus is important disease. So I would focus on this particular two disease, and then I will deal with the particular pharmacodynamics of this Karna Purana and all. So what is too loud? This damage occurs to the inner ear. After people experience one single extremely loud noise, gunshot close to their ear, or loud noise over a long period of time. It is a combination of both threshold as well as duration. Just like I told you, आपका frequency बहुत कम है, मतलब the sound in dB decimal आपका कोई 40 dB का sound आप सुन रहे हैं, which is considered as safe. But if the prolonged exposure is there more than 4 hours, consistently this particular mechanical sound waves are striking your tympanic membrane, and that threshold will be more dangerous. So sound injuries to cochlear nerve, just 1 or 140 decimal noise for a second is very injurious, and 100 decimal noise for a second is not injurious. So, but over a period of several hours, says week, months or year, if it is the phenomena is consistent, आपके कान के पास अभी जैसे कंस्ट्रक्शन के काम चल रहे हैं, डीजे लगाते हैं लोग हेडफोन में. Today I put headphone in my ear, but I am against of this. I always advise you should not put headphones in your ears. So this is also damaging to your this particular cochlear nerve. So ear problems, neurological disorders, psychiatric disorders, metabolic disorders, miscellaneous. So modern aspect we should know before we will go into the Vata Shamaka Chikitsa or Balya or Snigdha Chikitsa. We should know what is the underlying cause of this tinnitus in terms of modern perspective. So ear problems, neurological disorders, psychiatric, sometimes ENT surgeon could not find out what is the cause, what must be the cause of tinnitus. And then he said, "Arey, ye to idiopathic hai, ye to psychological hai," or then the particular person is sent to the neurologist or psychiatrist. So we have to consider n number of aspects while before treating the particular person. Ear problems and the neurological conditions, metabolic disorder, psychiatric disorders, miscellaneous, as all of we know. कभी कभी हमारी कान में ऐसे ही बजने लगता है जब बहुत ज्यादा एंजाइटी और स्ट्रेस हो, आंखों के तारे सामने चमकना, कान में बहुत सारी आवाजें सुनाई देना. That ear problems, all of us know that tinnitus or sensorineural deafness. What is the culprit underlying cause? Otitis externa, noise-induced pollution, middle ear infusion, right? Meniere's disease. There are so many underlying autotoxic medicine, ofloxacin hai, sensorineural, this chloroquine phosphate hai, streptomyces hai, anticox TB regimen hai, AKT regimen hai, sorbitrate hai, blood thinners hai. एंटी-हाइपरटेंसिव मेडिसिन है, सॉर्बिट्रेट जैसे जो ड्रग्स है, उसके ऊपर प्रोलॉन्ग पेशेंट्स आर ऑन दिस पर्टिकुलर व्हेन देयर इज अ डिफिशियंसी ऑफ B1 B6 B12, ऑल ऑफ वी नो द न्यूरोकाइंड प्लस दैट ENT सर्जन ऑलवेज प्रिस्क्राइब, आप न्यूरोकाइंड प्लस टैबलेट ले लीजिए, और आपका अगर कान में आवाज आए तो दैट इज द ओनली एंटीऑक्सीडेंट पर्टिकुलर थेरेपी दे यूज्ड टू एंड स्टेरॉइड्स. इनिशियल स्टेजेस इन सेंसोरियल डेफनेस और इन द पर्टिकुलर tinnitus cases they prescribe the steroid, corticosteroid, as well as the neurokind plus. So miscellaneous में there are n number of autosclerosis, hypertonia, and this global, there are n number of particular underlying conditions are there, because it is a very vast topic: deafness, tinnitus, conductive, sensorineural. So today we would focus on the Ayurveda part and treatment. For that, please let me finish this pulsatile tinnitus. So pulsatile tinnitus can be categorized as either pulse synchrosis, where the rhythm of the noise or click is synchronized with the heartbeats. जैसे अपने हार्टबीट चलते हैं वैसे वो सिंक्रोनाइजेशन में पूरा टिनिटस का पेशेंट को सुनाई देता है. देन पल्स सिंक्रोनाइज्ड टिनिटस माइट हैव एन अंडरलाइंग वस्कुलर कॉज. अगर वस्कुलर कॉज है उसके लिए भी ऐसा होता है. देन मोस्ट कॉमन इज इडियोपैथिक intracranial, just like I told you, the hypertension caused by elevated intracranial pressure that transfer pulsation through the cerebrospinal fluid. Through the cerebrospinal fluid, that pulsation is transferred, and patient used to hear this particular, because centers are here. Vibrations are then transferred to the fluid in the cochlea, causing the tinnitus. So Unilateral tinnitus might also result from the chronic noise exposure, acoustic trauma, semicircular canal cases. Bilateral tinnitus is most commonly caused by noise exposure, age-related hearing loss, and otosclerosis, right? So diagnosis is important in this case. Severity, as I said, so we go for otoscopy. As all of learned person are sitting here, actually I am providing this information for my students. This, first of all, we go for otoscopic evaluation. We try to assess whether there is earwax or something discharge or perforation is there, whether external auditory canal is okay or tympanic membrane is okay. And then we go for Rinne's and Weber's test. Initially, when person say he cannot hear, sometimes person never accept. We have to find out, yes, there is a particular deficiency in terms of particular hearing loss has occurred. So audiometry, pure tone audiometry unit we have in this YMT Erla Medical College, and I myself do the audiometry of the patients. So no audiologist is here. So I do pure tone audiometry, and pure tone audiometry we can find out how much decimal loss is occur, whether it is 70 dB, 80, 90, whether it is a profound hearing loss, whether it is a particular audiometry report, which is a conductive hearing loss, which is a sensory neural hearing loss. So diagnostic tests are like that. This was subjective, objective, that I already discussed. So classification of the degree of hearing impairment and ability to perceive the sound. Two things at the same time. I am speaking about tinnitus. At the same time, I am speaking about the sensory neural deafness or hearing loss, because our title is ENT diseases. The two prominent ENT diseases I am talking about, modern and Ayurveda perspective. And treatment remains most of the same of the sensory neural hearing loss and tinnitus. So difficult to identify soft sound such as whispering 20 to 24 dB, then moderate up to 40 to 55 dB, then moderately severe up to 25. Up to 25 it is considered, yes, ki normal conversation are at, then you can hear the sound up to 25 dB. Then 40, 55 it is considered as moderate. Here in mild and moderate cases, Ayurveda can play a major important role in terms of Kriya-Kalpa. But let me tell you, not only Kriya-Kalpa, we will have to go for systemic intervention of the diseases. Unless and until systemic intervention we do, underlying cause we treat, and Prakriti we cannot find out, we will have to, the major mistake we used to do while planning the Ayurveda mode of treatment, there are very few people or Ayurveda consultant who first go for the Prakriti of the patient, because when two different patients are having two different Prakriti, Vata Pittacha or Kapha Vatacha or Kapha Pittacha, the treatment modality of the chosen, what will be chosen will be totally different. So up to the mild and moderate cases, we can have a very good results. Moderately severe cases also, in unable to clearly hear sound, noise much as telephone ring 55 to. Just now this Yuvraj Kale sir spoke that particular, if the case study Keskar madam would have presented, then it would have been better. So recently I was in back Goa and I have presented my case on sensory neural deafnesses, where profound hearing loss was there, audiometric evaluation before and after, and Nasya Karnapura and a particular medicines Mahavat Vidvansa I have given to the 48-year-old post. And I think Patil sir was there who was for evaluating that score, and there are a number of persons. So I got a best paper award over there, that particular case study. And now from profound hearing loss is converted into the moderate hearing loss. So profound hearing loss is very difficult. So hearing impairment, if there is something not working in the ear canal, eardrum, middle ear, there are a number of causes. There is a earwax is present, or discharge is present, or otitis media is there. On the other hand, sensory neural part, cochlea, auditory nerve, or brain center, it is more commonly result in a sensory neural hearing impairment. When someone has both sensory neural as well as conductive hearing impairments, it is called that mixed hearing loss. Mixed hearing loss, when both the kind of weight is obstructed. So tinnitus associated with hearing impairment affect on following career development parameters. Why this topic, as I am speaking in this national webinar, and I would like to emphasize particularly these critical issues of sensory neural deafness and tinnitus, because it affects the society, it affects your professional career, where patient lose its self-confidence, because you are speaking to me and I am not able to listen to you, and I feel ashamed, I feel ashamed to accept this. Yes, I cannot hear. Please pardon, please speak me out, please speak me loud. Then everybody will definitely, now our society has accepted spectacles, visual aid, but hearing aid is still a stigma. Hearing aid is still a stigma. It has not wide acceptance like spectacles. So that since then I have decided that I will do something for this particular sensory neural deafness issue. So language, how it affects the society, because we are MUHS and MCIM. Why this particular topic is chosen? Because it has a larger impact on the society. When somebody is having a deafness issue or tinnitus issue, there are n number of students and elderly and middle-aged person who are working, and they are facing such kind of issues, and they lose their self-confidence. They try to lag behind. They don't come forward, and even they go through depression sometimes. Anxiety, insomnia, tinnitus, deafness, all these things goes hand in hand. I would like to say all this academic performance be affected. There are n number of cases when I post this my YouTube, there my video is there on YouTube, management of hearing loss, where youngsters from 18 to 25, so many people approached to me, student, and they have decided that suicidal attempt they have made because of this tinnitus and sensory neural deafness issue. So this kind of larger impact on society is there. So diabetes is the culprit. All of systemic diseases are always responsible to a particular cochlear nerve degeneration and vestibular nerve degeneration or Meniere's disease. So dizziness and hearing impairment and this particular craving of insulin is responsible for this metabolic activity of the cell, or is hampered due to the lacking of the deficiency of the insulin. So management, reassurance and relaxations, and literally in the ENT fraternity, I spoke to many my ENT friends, and they said we really feel helpless to what to do. Doctor, do something. You are an Ayurveda doctor and you do something. Just come forward. What can be done for tinnitus and sensory neural deafness? So prevention is mainly primary prevention. I would aim as a minimizing the risk of trauma. नॉइज एक्सपोजर, अगर आप नॉइज एक्सपोजर में काम कर रहे हो, मशीन चल रही है, बिल्डिंग कंस्ट्रक्शन के काम चल रहे हैं, डीजे लगा रहे हो, जब कुछ बातें हमारे हाथ में होती है, कुछ नहीं होती है, इन दैट केस एटलीस्ट यू शुड गो फॉर ईयर मास्किंग. At least you can put a cotton bud or masks are available. Ear masking you should do so that mechanical trauma will be less. बाहर का जो वॉइस है वो आपको कम करना है. So meningitis और बाकी जैसे इन्फेक्शन है वो भी कम करना है. पीरियडिकल चेकअप, कितने लोग हैं 40 साल के बाद, अभी तो कॉमन है कि यू शुड गो फॉर रेटिनल फंडोस्कोपी, ऑप्थेल्मोस्कोपी. कितने लोग हैं जिन्होंने अपनी ऑडियोमेट्री करा ली है 40 साल के बाद? मैंने करा ली है. राइट नाउ माय एज इज 54 एंड फर्स्ट ऑफ ऑल मैंने ही मेरी ऑडियोमेट्री करा ली है. तो पीरियोडिकली हेल्थ चेकअप इज इम्पोर्टेंट, कि डिटोरिएशन का साउंड का पता नहीं चलता कि कब हमारा डिटोरिएट हो रहा है. सो आई वुड एडवाइज ऑल द आई वुड से 35 के बाद ही आपने ऑडियोमेट्री कराना है और चेक कराना है कि वेदर योर एवरीथिंग इज अंडर जीबी कंट्रोल. सो 80 डेसिमल साउंड, इफ यू हैव अ एक्सपोजर which frequency is more than 80 decimals, and if 8 hours you are spending in the particular environment, definitely teenagers, just like I put headphone for this particular conference purpose. So youngsters are continuously putting headphone and listening the sound, loud music, etc. And the previously the particular cochlear nerve degeneration occur at the age of 70. Nowadays this is preponed, I would say it is preponed, and it is occurred now in youngsters also. youngsters जो है हमारा ऊंचा सुनते हैं, जिसको हम बोलते हैं उन्हें सुनाई नहीं देता. Occupational or industrial workers such as who are working in high noise level, just as spoke you, they are more prone towards this. घर में टीवी भी देखना है तो कम आवाज में, बात भी करनी है तो कम आवाज में. अगर आप अवॉइड नहीं कर सकते तो you can put ear plug or ear masking. It's always better. Sound therapy is the use of external sound to mask the internal sound of tinnitus. So sound therapy is the use of an external sound to mask the internal sound of tinnitus you may be hearing. एक दूसरा भी एक इसमें एक ये आता है कि भाई कि अगर बिल्कुल ही पेशेंट को कोई रिस्पांस नहीं मिल रहा है ट्रीटमेंट से, पेशेंट में सुसाइडल अटेम्प्ट्स बहुत होते हैं ये टिनिटस के पेशेंट में, तो यू कैन डिस्ट्रैक्ट दैट पेशेंट टू द आउटर स्टिमुलस. उसके कान के बाहर कोई चीज आवाज आप ऐसा करो though two contradictory things I am speaking, ki baba particularly patient, we will distract the patient towards the outer stimuli so that he can be able to, he will be refocused or shift his focus from inner voice to outer voice. So habituation of both. So management with modern science, as all of you know, they give hearing aids, masking devices, then cochlear implants, cochlear stimulation devices are being investigated for severe intractable tinnitus cases. वहां पे जो डेफनेस में भी आप कॉक्लियर इम्प्लांट करते हैं, टिनिटस में भी कॉक्लियर इम्प्लांट करते हैं. सेंसोरी नर्व डेफनेस में आपको सुनाई नहीं देता है कॉक्लियर नर्व डिजनरेशन के कारण, बट इन द टिनिटस देयर आर रिपीटेशन ऑफ द साउंड, पर्टिकुलरली देयर आर टू इश्यूज. सो इन एनी वे, so in this particular lidocaine तक introduce करना पड़ता है, lidocaine directly into the inner ear, so that being used in some cases. Pharmacotherapy, as all of you know, we should know what is going on, what kind of underlying causes, and we have to take into consideration while planning the treatment. So acute tinnitus में corticosteroids, then nootropics, lidocaine is given, then local therapy में corticosteroids देते हैं. क्रॉनिक टिनिटस में एंटी डिप्रेसेंट, एंटी कन्वर्सेंट देना पड़ता है, देन ग्लूटामेट रिसेप्टर एंटागोनिस्ट भी देते हैं पेशेंट को. सो दिस काइंड ऑफ फार्माकोथेरेपी इज अवेलेबल एट द वन हैंड, बट आई हैव डेटा ऑफ द पेशेंट वेयर दिस पर्टिकुलर ट्रीटमेंट फाउंड, जिसको बोलते हैं कि फ्रूटफुल नहीं हुई है ट्रीटमेंट, इन वेन पेशेंट इज नॉट एट ऑल satisfied or happy, and symptoms and treatment remains continue. So others also, particular this kind of zinc vitamin tablets, we should know the zinc tablets, vitamin tablets, antihistamine, antioxidant, nimlodipine, furosemide, paraxamide, this kind of medicines ENT surgeons are prescribing, right? They, at the last, they give the tranquilizer and antidepressant and पेशेंट को सुला के ही रखते हैं. ठीक है. सो रिसेंट एडवांसेस में मैग्नेटिक एंड इलेक्ट्रिकल ब्रेन स्टिमुलेशन देते हैं, एकॉस्टिक कोऑर्डिनेटेड रिसेट न्यूरो मॉड्यूलेशन देते हैं रिसेंट एडवांसेस में, बट स्टिल देयर इज अ प्रॉब्लम एंड वी कैन स्टिल वी हैव अ होप. So now I would come to a topic of Ayurvedic perspective, Ayurveda approach, what we can do for such patients who are suffering with sensorineural deafness, tinnitus, especially where hearing loss as well as exaggerated hearing. In both the cases, Ayurvedic approach. See here, all of you know, as just sir told that I have completed my post-graduation in Rasashastra and Vaishajya Kalpana for Poddar in 1994. In that time, particularly, I have studied all these herbs very, and qualitative analysis I have done at that time. And for my study, I got gold medal for that. But because in 94, in that era, that study was considered as a unique study, because we are trying to find out the active ingredient abstract, what Vidania somnifera or Bilva, our Dashamula, this kind of key herbs were there, and we are enriched with the materia medica. We have a better permutation and combination, and we can go with this Ayurveda and we can cure the illness. So Shalakya Tantra already preservation and restoration of Indriya. As everybody knows, we are here to swasthastha swasthya rakshanam. इसलिए मैंने कहा कि सबसे पहले मैंने मेरी ऑडियोमेट्री करा ली, और उसके बाद मैं एडवाइस करती हूँ कि जिनको चश्मा नहीं लगा है वो भी चश्मा ना लगे ऐसा प्रयास करें, जिनको अच्छा सुनाई देता है उन्होंने भी अपने हाउ दे कैन रेस्टोर देयर इंद्रिय सेंस ऑर्गन्स, दे शुड डू इट रेगुलरली by following दिनचर्या ऋतुचर्या स्वस्थ ऑफ कोर्स. सो डायरेक्टली आप महावात विध्वंस दे दोगे, पालसी न्यूरॉन दे दोगे, पेशेंट का टिनिटस कम हो जाएगा, ऐसा नहीं. सो आयुर्वेदा पर्सपेक्टिव में कर्णनादा is a karna roga, as I don't want to speak much on this particular aspect. It is out of 28 karna rogas it is considered, and in Ayurveda. So causative factors in ancient literature, in Sushrut Uttar Tantra chapter number 20, 21 and 22, it is devoted for this. 20 and 21 is devoted exclusively for this Karnagata Roga, chapter number 20 and 21, where this Karna Badhira issues dealt by Sushruta 5000 years back. जैसे मंजरी केसकर मैडम ने बताया कि this pharmacokinetic dynamic, what is the particular tissue contact time of the anjana, and what is the difference between the tissue contact time of the anjana, tarpana, parishika, bidalaka. उनको पता था, उनको तो ग्लाइकोमा का एंटीरियर चेंबर एंगल भी पता था. So according to ancient literature, these are the causative factors. What these causative factors denotes towards tinnitus and karnakshveda? Shrama, kshaya, ruksha bhojana, kshaya bhojana, Then these are शीत वासना, cold things, and शीत ऋतु. So cold thing आपने देखा होगा कि स्टेशन ट्यूब ब्लॉक्ड होना, कफ एंड कोल्ड होना, then conductive deafness, and again there is a inflammation, and in many of the cases sudden there is a station sudden deafness के भी cases मेरे तरफ आते हैं. तो particularly they are having the exposure towards cold, suddenly station tube blacked, and then patient complaints of blocking sensation, choking sensation, inflammation of the auditory nerve, inflammation of the station tube, and then thereafter it goes on deteriorating. So etiology as we know, as our karnagata vyadhi karna badhirya, I am not talking about vaccine ear or otitis media, but a deafness and tinnitus, that too particular sensory neural deafness and tinnitus, because in 1 year lecture I can cover only these two much diseases. So causative factors is the vata prakopa, increased vata prakopa, increased vata dosha due to your age, which we consider as presbyacus, due to your diet, due to your habitat. आप कितना नॉइज पोल्यूशन में घूम रहे हो और कितना रुक्ष आहार विहार ले रहे हो, और आप 8-8 10 घंटे, आप 2 घंटे ही सोते हो, 2 बजे सोते हो रात को और सुबह 6 बजे उठ जाते हो. डिप्राइव्ड स्लीप. आपने देखा होगा जिनको साउंड स्लीप कम आता है, जिनको साउंड स्लीप कम आता है वो लोग जो है उनको टिनिटस ज्यादा परेशान करता है. वंस द पेशेंट स्लिप्स, ये भी है फिनोमेना, वंस द पेशेंट स्लिप्स, जब ट्रैंक्विलाइजर देके पेशेंट को सुलाते हैं तो पेशेंट कैन नॉट हियर एनी काइंड ऑफ नॉइज. सो साउंड स्लीप इज मस्ट, बिकॉज इट विल इंक्रीज वाता प्रकोपा. एंड वाता प्रकोपा, कंसिडरिंग दिस पर्टिकुलर फिनोमेना, वी हैव टू प्लान द ट्रीटमेंट, right? So vata prakopa, increase vata dosha, affects the ear by creating ringing sound and thereby tinnitus occur. So specific hetus is karnanada, jalakrida, just I told you, there's ratri jagrana, ati vyayama, मिथ्या योगा, अपशस्त्र. अभी मैंने YouTube में मेरा वीडियो है, उसमें भी मैंने डाला है कि 80% तो सेल्फ डिस्ट्रक्टिव है, मतलब ईयरबड डाल के, चाबी पिन क्लिप डाल के पेशेंट ट्राई टू हैम्पर द इंट्रोड्यूस द इन्फेक्शन, and there is a trauma to the tympanic membrane, self-induced, self-destructive जिसको बोलते हैं. So you should not, those who are watching me and listening me, should not put this kind of earbud also. They think earbud is safe, but earbud touches the tympanic membrane, it destroys the tympanic membrane. So मिथ्या योगा आप शस्त्र तभी लिख के रखा है उन्होंने. Then प्रतिशाय is the culprit. सुष्ठुतंत्र चैप्टर 24 में कंप्लीट उन्होंने प्रतिशाय वर्णन ही किया है. So प्रतिशाय we should avoid if you want to save our hearing capacity. So specific hetus is lack of proper diet, dhatu kshaya, which ultimately causes vata prakopa. When vata goes to shabdavah srotasa, it causes karnanada. What is this shabdavah srotasa? And shabdavah srotasa are this particular centers of hearings. सेंटर ऑफ हियरिंग जो है वो, उसके साथ साथ आपके वेस्टिबुलर और कॉक्लियर नर्व है, आपका राउंड विंडो, ओवल विंडो और टाइनी हेयर सेल्स. इन द फर्स्ट 2 slides I have described the particular apparatus of this hearing, where mechanism of hearing I was explaining. In that particular tiny hair cells, semicircular canal get destroyed in tinnitus and in a particular, and this, it is said that once these tiny hair cells which are lies in the semicircular canal are destroyed, जिसे हम क्या कहेंगे कि वात, एक्सट्रीम वात प्रकोप ड्यू टू एक्सट्रीम धातु क्षय. अभी केवल धातु क्षय से वात प्रकोप होता है ऐसा नहीं है, उसमें कफ का भी आवरण होता है. इन कंडक्टिव डेफनेस, मिक्स डेफनेस, कफ का आवरण होता है वात के ऊपर. जब हम कफ का आवरण दूर करने के लिए जो चिकित्सा देते हैं, उसके बाद उसको वात धातु क्षयजन्य चिकित्सा से रिलीफ मिलना शुरू होता है. इट इज ऑल्सो प्रेजेंट एज लक्षण ऑफ द अदर डिसीजेस. So Rupa, as we all of you know, with different types of sound hearing in the Shabdava Srotasa, hearing capacity is deteriorated or hearing capacity is exaggerated in case of tinnitus. So this kind of picture patient will be presented with this picture. Preventive measure, Ayurveda system of medicine enhances more preventive measures which are lacking in contemporary science. कैसा है, एक बार मेरे पास अगर profound hearing loss वाला patient आ गया, या एज रिलेटेड मैकुलर डिजनरेशन वाला आ गया 40 साल में मैकुलर डिजनरेशन का केस, then there is very less in our hands. So if we emphasize on how to protect our ears, how to protect our ears by not indulging into high frequency, high volume sound, so we, in that way we can save our ear, we can save our hearing capacity, we can take care of our cochlear nerve. So vata nadi संस्थान, nervous system, cochlear nerve, ये तो पहले ही बताया कि वातनाड़ी संस्थान we can correlate with the neurological tissues, how neurological tiny hair cells are once destroyed and it becomes difficult to regenerate them. So identifying Nidana and avoiding it form the key role in preventing most of the ENT diseases. We can protect the ears from the sound pollution. We can protect the ears from introducing the infection into the auditory canal. We can take care so that we don't have episodes of rhinitis, sneezing attacks, or running of nose, sinusitis that can ultimately it will deteriorate your eustachian tube, and ultimately your middle ear is affected, and this conductive deafness issues and then mixed kind of deafness we will have to deal with this. So hence it is highly essential to identify and treat the common ENT disorders seen in clinical practice with the Ayurvedic measures. Samprapti, all we know, vitiated vata dosha either enter into other channels or encircled kapha dosha, जसं मी सांगितलं, आवरण आवरक विचार, kapha dosha in shabdava srotosa, different types of sounds like bheri or mridanga is heard by the patients. So samprapti or pathogenesis में vata dominance tridosha along with the rakta presents as the chief pathological factors in the case of karnanada or hearing, karnanada and sensorineural deafness, karnabadhira. With these two issues, we will see how the Kriya-Kalpa plays a role. So grita having property of sanskara, anuvartana, when processed with the vata shamaka drugs and having rasayana guna, becomes the best line of treatment for the karna. We need not to prescribe zinc, we need not to prescribe rasayan. In my OPD paper or IPD paper, I never prescribe antioxidant. I always prefer saptamrutlo, I always prefer nishadatri, I always prefer rasayan churna. Even one step beyond, I give particular ship my patient into the basti, karna, badhirya and basti. So I used to give shift the patient on matra basti or anuvasana basti. The use of sneha, especially taila, helps to subside the vata dosha and clears the srotasa of the karna. So here I would like to emphasize on herbs, specifically ashwagandha, Vidania somniferea. It has all we know that is a nerve tonic and it's at balya, brihana, rasayana properties. Thus, it can prevent the age-related degenerative changes or where there is an early degeneration occur due to the destruction of the tiny hair cells of the semicircular canal. इसके वजह से अगर आता है तो भी अश्वगंधा में विदानिया सोमनिफेरा जो ड्रग है वंडरफुल, it has a number of impact, as all of we know, rasayan from rasayan vajikarana to vata pitta shamak to all kind of anxiety reliever, stress buster, and it will definitely give provide nourishment to our nerve fibers also. So it is used as adaptogen substance said to increase the ability to withstand the stress of all types. तो ये अश्वगंधा जो है it will act on particularly, it will strengthen or improve the particular organ, that's cochlea, and it will increase the hearing capacity. All these properties helps in improving the blood supply of the inner ear and reduce the acuity of the tinnitus felt by the patient. So ashwagandha also releases the serotonin. Just now I told you, though I am invited here to speak on this Kriya-Kalpas, specifically ENT disorders. So, but in ENT disorders, there are Karna Purana and Nasya, what we are doing. But there are, along with the Karna Purana and Nasya, these particular herbs are plays very much important role. These are the modalities. It's just like Tarpana, Nasya, Putpaka. Here, Gandusha, Nasya and Karna Purana has definitely has a good effect on this sensorineural deafness or tinnitus. But along with that, if we choose a proper particular drug, that will help, because it is a systemic disease. वाता दोष मला नेहमी वाटायचं, मुझे ऐसा लगता था कि हम केवल कान में कर्णपूरण करके ही पेशेंट का लोकल टॉपिकल ट्रीटमेंट है ये, लेकिन इसका अब्सॉर्प्शन भी सिस्टमिक ब्लड सर्कुलेशन में होता है. आई वोंट से इट इज अ टॉपिकल ट्रीटमेंट बिकॉज सिस्टमिक रिलीज भी होता है इसका सर्कुलेशन में. बट इफ आई कैन गो फॉर बस्ती, तो मैंने निरूह दिए, उसके बाद मात्रा बस्ती दिया, अनुवासन दिया. सो अनुवासन और मात्रा बस्ती दशमूल तेल से, महानारायण तेल से, बला तेल से, दिस काइंड ऑफ ये बस्ती केवल इसका पायलट स्टडी किया कि एक पेशेंट को केवल बस्ती देना है और कुछ एक पेशेंट को केवल कर्णपूर्णा पे रखना है, एक ग्रुप पे कर्णपूर्णा भी देना है और बस्ती भी देना है. दैट काइंड ऑफ ट्रीटमेंट इज गोइंग अंडर मी दिस पर्टिकुलर दिस सेंसोरियल डेफनेस इशू. सो अश्वगंधा और ये मेजर रिलीफ ये देते हैं. उसके बाद कोरिलेशन विद द क्लिनिकल कंडीशन, Ayurveda management. Then we will shift into the Ayurveda management as everyone knows that Karna Purana. This Karna Purana is a Kriya-Kalpa. Kriya-Kalpa actually डोळ्यांच्या यालाच आपल्याकडे जास्त क्रियाकल्प दिलेले आहेत, पण डेफनेस आणि टिनिटस. आय एम ऑडिबल सर? हॅलो,
येस
आय
मॅम.
एम ऑडिबल. ओके, कारण की मला सांगा तुम्ही ऑडिबल नसेल तर.
येस
सो बिकॉज सी सर ऍक्च्युअली व्हॉट हॅपन्स, लेट मी हे ऍक्च्युअली काय झालंय की क्रियाकल्प जरी हा आजचा विषय असेल तरी मला असं वाटलं की रिपीटेडली आय एम clarifying ki I would not speaking only on Kriya Kalpa, but this particular tinnitus and sensory diffuse are major, very much essential to address, and successful remedy I have got. So successful remedy I am doing in my OPD at Y.M.T Medical College. So you can refer patients to me, and the viewers who are watching here that also came with their audiometry report भी हम लोग यहाँ कर लेते. तो कर्णपूर्णा, सो आयुर्वेदा मैनेजमेंट का विथ महामाशा तेल आफ्टर सनसेट बताया कि कर्णपूर्णा आपको करना है. सो जब व्हेन आई वाज इन ईजू तब हम सोचते थे कि कर्णपूर्णा करने से कैसे क्या पेशेंट को सुनाई देने लगेगा. सो हियर द फार्माकोडायनामिक्स एंड काइनेटिक्स वर्क्स वेयर हाउ द ड्रग एब्सॉर्प्शन, व्हेन एज आई बिलोंग्स टू रसशास्त्र, आई नो द फार्माकोकाइनेटिक, हाउ द ड्रग इज एब्सॉर्ब्ड एंड हाउ इट increases the vasodilation. Once you install a oil, before installation of your Karnapurna, they introduce you oil, you have to introduce oil, that is til tel, dashmul tel, mahanarayan tel, ashwagandha tel, and number of formulations are given once. But before that, you have to give gentle massage on mastoid bone, auricle, pinna. That is very important. That is also another observation study. You can plan it कि if you don't go for proper pre-op जैसे करते हैं, then operative and post-operative जो नहीं होते सकती है successful, in the same manner 10 to 15 times you have to rub over here the mastoid bone, auricle, pinna, and then after proper oleation and then proper fermentation, then आपको नाड़ी स्वेद देना है. पर्टिकुलर हर्ब्स है नाड़ी स्वेद, अगर आप देंगे तो नाड़ी स्वेद से then thereby you will increase the vasodilation and permeability of the, after all यहाँ पे भ्राजक पित्त है सर. आई वुड से कि यहाँ ऑडिटरी कैन यू कैन सी, दो इट इज सिंपल थिंग. हमें ऐसी छोटी छोटी चीजें बहुत ही ऐसा लगता है इससे क्या होगा, that kind of attitude even our Ayurveda graduates are having. Forget about modern science. We people ourselves, we never give respect to our science, and we always see कि yes, तेल तूप कानात नाकात टाकल्याने काय होणार आहे. That kind of allegation is made by our fraternity also. Forget about modern surgeon. I don't want to criticize anybody, but I have a data and I have a case studies also. I have audiometric evaluation before and audiometric evaluation after also. So Kriya Kalpa as well as Karnapurna. This Karnapurna, if it is done properly, it is having a very good impact. मतलब patient Karnapurna करने के बाद it has a very soothing effect. पेशंट बोलते की आवाज कमी झाला हो मॅडम, ते काही नाही पण मला शांत झोप आली कर्णपूरण केल्याबरोबर, असं पण सांगतात. सो this particular vasodilation, permeability of the capillaries increase, and in the auditory canal there is a bhrajak pitta. भ्राजक पित्त, साधक पित्त जसं असतं, आलोचक पित्त जसं डोळ्यात आहे, तसं भ्राजक पित्त जे आहे, इट विल दिस पर्टिक्युलर हर्ब्स, अश्वगंधा, दशमूल, दिस काइंड ऑफ बिल्व, this kind of particular herbs are neurotonic. They are give strength to your muscles or nerve tissues, and this we call as a, where there is a bhrajak pitta is there, it will goes into the systemic circulation. Just when we put refresh plus eye drop or lacril plus, it will never establish tear film. When we use the lipophilic or hydrophilic like a Snehapak Kalpan जसं सांगितलं आपलं त्रिफलागृत, it is a hydrophilic, lipophilic in nature, and how the corneal penetration is there and how we re-establish the tear film. In the same manner, it is going through the auditory canal. There is a skin means bhrajaka pitta, and vasodilation after fermentation occur, as everybody know, even modern science has accepted there is a vasodilation, then thereby skin मध्ये permeability increases, and then there will be better drug absorption. See, तो बेटर ड्रग्स ऍब्सॉर्प्शन सुद्धा त्यातून होतं. सो प्रधान कर्मा ऍज मेडिकेटेड ऑइल शुड बी जेंटली वॉर्म कीपिंग इन lukewarm water. Everybody knows the procedures of Karnapurna, and 10 drops, 10 to 12 drops are sufficient. Before going for Karnapurna, I used to go or do audiometry, and 3 cycles I always suggest or recommend. But merely putting Karnapurna, putting nasal drop, Nasya or whatever, it is not going to solve the problem. You have to first Ashtavidya Parikshana, then you have to go for proper identify the prakriti of the patient, habit or habitat. जसं मी एखाद्या पेशंटला तर्पण दिलं अँड दॅट पेशंटचा स्क्रीन टाइम आहे फक्त 2 तास, आणि एखाद्या पेशंटला मी कॉम्प्युटर विजन सिंड्रोम, ड्राय सिंड्रोम साठी तर्पण दिलं, सेम इन्ग्रेडियंट सेम बट ही स्पेंडिंग 8 hours and treatment is continuing in both the individuals. What will happen? Another person will not get result. बोलेगा मैडम इतना कोई खास मुझे फायदा नहीं हुआ है, लेकिन जो पर्सन है उसका स्क्रीन टाइम कम है, डेफिनेटली हैबिटेट, पर्टिकुलर डाइट. अगर मेरे पास जो कर्ण बाधिरे के पेशेंट आते हैं, तो कर्ण बाधिरे के पेशेंट में पर्टिकुलरली आई यूज टू टेक चार्ज ऑफ हिज डाइट, व्हाट दैट पर्सन इज ईटिंग, डूज अँड डोंट्स, काय खायला पाहिजे काय नाही खायला पाहिजे. So the medicated liquid should be gently warmed by keeping in lukewarm water. The external auditory canal should be strengthened by pulling the pinna. हा पिन्ना जो आहे बॅकवर्ड करायचा, आणि जसा पिन्ना बॅकवर्ड केला आणि अपवर्ड केला तसं ऑइल पोअर चांगलं होतं. Anal, then auditory canal is fully filled. You have to maintain the temperature. You can use the infrared, or you have to particular maintain the temperature once you install. 10 minutes are sufficient. ग्रंथामध्ये जे सांगितलंय कर्णपूर्ण, ENT आणि क्रियाकल्प असा जेव्हा विषय येतो तेव्हा कर्णपूर्ण, नस्य आणि गंडूशय याचाच विचार केला जातो. तर आजचा आपला हा विषय क्रियाकल्प आहे. तर क्रियाकल्प करताना पूर्वकर्म हे करणं गरजेचं आहे. तो आफ्टर सनसेट द रूट ऑफ द इयर शुड बी जेंटली मसाज टू पोटेन्शिएट द ऍक्शन ऑफ द ड्रग, and the medicated oil should be retained on the same position for 100 matras. Here it is said it is 100 matras, but I used to put 10 to 15 minutes. 15 minutes I used to maintain the temperature. 15 minutes you have to put the air canal filled with this particular medicated oil. You have to choose properly according to prakriti and deterioration of the sound. Your audiometer will help you in this regard. So hearing loss get improved up to 70 to 80. Suppose एखाद्याचा सिव्हिअर हिअरिंग लॉस आहे 70-80, ही विल कम अप टू 40 dB डेसिमल, 40 डेसिमल पर्यंत येतो. 40चा असेल तर 25 पर्यंत. 10 dB शिफ्ट अकर इन 1 month or 15 days. 3 to 4 cycles I would advocate of Karnapurna. And Karnapurna, I told you, it particularly systemic intervention. आता दुसरं नुसतं कर्णपूर्णा केलंय, पण सिस्टमिक इंटरव्हेन्शन करणार म्हणजे काय, ती पूर्ण शरीरातला वात कमी करणार, पूर्ण शरीरातली स्निग्धता वाढवणार, बल्य होणार. त्याच वेळेला देन आय हॅव थॉट दॅट आय शुड ऍडव्होकेट और ऍडमिनिस्टर दिस पर्टिक्युलर ड्रग थ्रू द पक्वाशया, ज्याला आपण म्हणतो की बस्ती मार्गाने पक्वाशयामध्ये जिथे वात प्रकोप झालाय मूळ, त्यालाच आपल्याला जर दूर करता आलं तर कर्णपूर्णा करून करून जेवढा रिझल्ट मिळणार नाही तेवढा पक्वाशयगत वाद जो आहे. पण पक्वाशयगत वाद जर दूर करायचा असेल तर त्याचं सुद्धा ऍब्सॉर्प्शन आहे. हाऊ द ड्रग ऍब्सॉर्प्शन अकर थ्रू द गट्स, एलिमेंटरी कॅनॉल कसा अकरेल, त्याला अग्नी, मॅडम टोल अग्नी विचार, या जाठराग्नी, पंचमहाभूताग्नी, that is important. If your आमपाचन before that, before Karnapurna, even if I go for Nasya, Karnapurna, Tarpan, Putpaka, I always focus, see आमावस्था अगर जर असेल तर त्रिकटू चूर्ण आहे, या चित्रकाती वटी आहे, त्रिकटू चूर्ण आहे, आमपाचक वटी आहे. आय यूज टू ऍडमिनिस्टर बिफोर 20 minutes फॉर 10 days. पिप्पली चूर्ण आहे, सिंपल आमपाचक, त्रिकटू जर हार्श वाटत असेल तर हे जर तुम्ही दिलं, आणि नंतर इफ यू स्टार्ट पर्टिक्युलरली क्लिनिकल प्लॅन द ट्रीटमेंट प्रोटोकॉल, बिफोर ट्रीटमेंट प्रोटोकॉल advise this, identify the prakriti, आमपाचन, अग्नि, because if we particular administer drug to Pakvashaya, as all of you know, the person who belongs to Panchakarma Kaya Chikitsa knows better, unless and until Agni is not good, we cannot administer the drug to Basti, and definitely it will not absorb. It will not. आता तुम्ही महात्रिफला ग्रुप जेव्हा पोटात घेता त्याच्यानंतर तुमचा कॉर्नेल ड्रायनेस कमी होतो, तर्पण करताय आणि जर पोटामध्ये त्रिफला ग्रुप घेताय तर त्रिफला ग्रुप घेतल्यानं सुद्धा कॉर्नल ड्रायनेस कमी होतो, राईट. म्हणजे जो स्निग्धांश जो आहे, इट अंडरलाइज दिस स्निग्धांश जो आहे थ्रू द परमिएबिलिटी, ऑस्मोसिस, ऑल ऑफ वी नो द ऑस्मोसिस, permeability of the particular at cellular level. linings in the skin or in the tissue, there are it increases the permeability of the due to the osmosis theory, and through this particular phenomena, the osmosis or permeability or vasodilation, this particular oil or medicine which I put into the pakvasha, which I put into the Karnapurna, or which I introduce in the notes, it definitely get absorbed and it goes into the systemic intervention, and definitely your cochlear nerve degeneration that we can arrest or we can improve. So proper sleep. Then Shamana Aushadha. So महावात विध्वंस रस जो आहे तो द्यायचाच आहे, पण कसा द्यायचा हा सेन्सोरिनल डेफनेससाठी जास्त कामात येतो. महावात विध्वंस 250 milligram PD or 250 milligram TDS I used to give after Amapajana. Once the Amapachana is over, and then you have to shift the patient to the particular snigdhansha. जसं त्रिफला घृत आहे किंवा हरे मूग आहे, सैंधव आहे. I totally eradicate the salt, whatever the iodized so-called salt is in the market. घाण्याचं तेल, घाण्यातून काढलेलं तेल मिळतं आता हल्ली, ते तेल ऍडव्होकेट करते मी घ्यायला. स्निग्धांश का चाललाय? डबल फिल्टर्ड जो ऑइल आपण यूज करतो, दॅट वी शुड डिस्कार्ड. देन दी थिअरी हॅज बीन प्रूव्ह की लिपिड प्रोफाइल हॅज नथिंग टू डू विथ द डबल फिल्टर्ड ऑइल. Right? Replace your iodized so-called namak with the सैंधव लवण. सैंधव लवण आहे जसं चक्षुष आहे तसं ते या इंद्रियाला सुद्धा हे करतं. वात जे आहे ते शामक आहे सैंधव लवण. देन तुमचं तिळतेल जे आहे ते घाण्याचं काढलेलं जर तिळतेल आहे, तुमच्या जेवणामध्ये तुम्ही स्निग्धांश किती घेता, तुम्ही ऑलमोंड्स किती घेता, तुम्ही ड्रायफ्रुट्स खाल्ले पण तुमचं अग्नीच नाहीये बरोबर, तर तुम्ही ड्रायफ्रुट्स खाल्लेले काहीच त्याचा स्निग्धांश शरीरामध्ये झिरपणार नाही. सो टंकण भस्म 250 milligram, गिलोय सत्व. Then गोदंती भस्म विथ हनी अर्ली मॉर्निंग और इन द इव्हिनिंग. गोदंती भस्म सुद्धा तुमच्या कॉक्लिअर नर्व डिजनरेशनला, तुमच्या पर्टिक्युलर मिडल इयर मधले जे बोनी चेन आहे इनकस स्टेपीस और याच्यासाठी गोदंती भस्म, अस्थिवहस्रुतस और गोदंती भस्म अतिशय युजफुल आहे. सो अश्वगंधा, ऍज वी नो, द नर्वाइन टॉनिक आहे, नर्वस टिश्यू, अँड इट इज एन्झायटी. इट विल रिड्यूस द एन्झायटी, इट विल रिड्यूस द एपिसोड्स ऑफ टिनिटस. डेफिनेटली जेव्हा आपल्या मनामध्ये खूप विचारांचा गोंधळ असतो, वेन वी एन नंबर ऑफ थॉट, अँड आय ऑलवेज advise the patient go for meditation also, right? When our thoughts, we can minimize the number of thoughts, the tinnitus also will minimize. विचाराचा गोंधळ वाढला की कानातला गोंधळ पण खूप जास्त वाढतो. सो अश्वगंधा चूर्ण, बलारिष्ट, बला, अश्वगंधा, जिवंतादी वर्गातली कृती, दशमूलादी कृती, जसं त्यांनी सांगितलं की बिल्वादी तेल, बिल्वादी गणातली द्रव्य, ही सगळी द्रव्य जी आहे स्निग्ध, मधुर विपाकी, उष्ण, पण सगळी स्निग्ध, उष्ण आणि मधुर विपाकी द्रव्यांनी वातदोष कमी होतो असा नाही, किंवा पर्टिक्युलर जे आहेत द्रव्य. तर ह्या बुस्टर इफेक्ट, तर टंकणा, गिलोया आणि अश्वगंधा हॅज अ बुस्टर इफेक्ट विच इज बेनिफिशियल इन कर्णनादा, as weak immunity is also considered as contributing factor in the occurrence of कर्णनादा. As मला तुम्हाला माहिती आहे की जेव्हा पेशंट मेन कंप्लेंट्स की मला अंधारी येते, चक्कर येते, देन फ्रॉम द रिसेप्शन काउंटर द पेशंट इज सेंड टू द ऑप्थॅल्मिक ओपीडी. पेशंटला चक्कर येते किंवा डोळ्यासमोर अंधारी येते, तो पेशंट तो काय चिकित्सक असतो, बिकॉज रक्तधातूच कमी आहे. दॅट इज अ केस ऑफ मेडिसिन, नॉट अ केस ऑफ ऑप्थॅल्मॉलॉजी. की रक्तधातू आणि अंबरपियुष, as we know, Ambara Piyush is very necessary for the brain to work. After all, sensory pathway, motor pathway, 12 cranial nerves, we know this particular vestibular nerve or cochlear nerve, we know from where it gets the direction. So in that cases, in that particular vata dosh, the all theory revolves around vata dosh and vata dosh, whether it is covered or uncovered. Sometimes we don't get the relief in treatment because of the avaran of kapha is there. In that case, we have to use patharishta. In that case, we have to use abhaya haritaki, tankana bhasma. That in that particular case, we have to inculcate this kapha avarana. Then karnapurna itself is a vatashamaka process. Just I told you that process when given with a mahamasha tel. Again, it is snigdha ushna guna udida sangitla hai. Snehana has the best action. Just now I was describing ki vata diseases is bruhan, which causes shamana of dhatukshayajanya vata vyadhi. The probable mode of action, we can, after all, these are all theories. Yes, these are all theories, but we can see the result बिकॉज देर आर सब्जेक्टिव्ह and ऑब्जेक्टिव्ह क्रायटेरिया. सब्जेक्टिव्हिटी म्हणजे मला ऐकू येत नाही किंवा मला खूप आवाज येतो. आणि ऑब्जेक्टिव्हिटी इज युअर ऑडिओमेट्रिक इव्हॅल्युएशन, युअर डिटोरेशन किती होत आहे किती नाही होत आहे, वेदर इट इज इम्प्रूव्ड और नॉट. दॅट काइंड ऑफ ऑब्जेक्टिव्ह parameters we are having, whether improved or not after Karnapurna, after Nasya, after a Kavala condition. So probable mode of action, Karnapurna of the patient is done with the Mahamasha tel. Based on this content, probable mode of action can be explained. So contains, it contain Masha, आता तुम्हाला माहिती की उडीद, it contains the aspartic acid, which plays an important role in the hormone production and thus helps the nervous system to work properly. If serotonin is released or feel good hormone is released, we are happy. आपल्याला माहिती आहे की there are n number of harmful hormones are secreted and wound heal होत नाही. शल्यचे जे लोक असतील इथे किंवा सर्जरी, तुम्हाला माहिती आहे की wound healing करण्यामध्ये bad hormones when it is secreted, and in that case the wound never heals faster. So to feel good hormone secret or not, to be happy, that's why anxiety relieving drugs are prescribed by the modern science. So patient will have a sound sleep and patient will heal. And whatever the problems, underlying causes for, whether it's a tinnitus, whether it is a deafness, that particular degenerative changes that are wound healing जर करायचं एखादी wound heal होत नसेल पायल्स ऑपरेटिव्ह मध्ये किंवा कुठल्याही ऑपरेशन मध्ये, if there is no wound healing problem, then sound sleep and relax rahana patient, that will definitely boost up your immunity and you will be benefited out of that. The second major substance found in masha म्हणजे उडीद, black gram, is glutamic acid. Aspartic acid and glutamic acid, it helps in protein production, which is said to be helpful in learning and memory production. So aspartic acid and glutamic acid is the major ingredient in black gram, ज्याला आपण काळी उडद म्हणतो, and it helps in protein production, which is said to be helpful in learning and memory production. So sesame oil, तिळाचं तेल तर घ्यायला सांगितलंय बेस. So sesame oil is a chemical composition that says also rich in glutamic acid and potassium, copper, choline, glutamic acid, zinc. It is enriched. नुसतं हातापायाला चोळलं तरी पेन कमी होतो, वातशूल असेल कर्णशूल कमी होतो. हाऊ इट सबसाइड्स? पेन मीन्स aggravated vata dosha, and we have to pacify the vata dosha. We go for external oleation, we go for fermentation, we use particular dashamula, rasna, eranda, ashwagandha and mahanarayan, bala and jivantadi and bilvadigana. That kind of materia medica we are having, and we can make a permutation and combination in terms of oral administration, in terms of matra basti, in terms of niro basti, in terms of nasal drop, in terms of पर्टिक्युलर कर्णपूर्णा. या सगळ्या गोष्टी सुवर्णासारखे ड्रग तुम्हाला बृहत्वत चिंतामणी आणि सुवर्ण मालिनी वसंत विल ऑल्सो प्लेस इम्पॉर्टंट रोल इन दिस पर्टिक्युलर व्हेअर डिजनरेशन अकर, धातुक्षयजन्य वात जेव्हा आहे, अँड इन दॅट पर्टिक्युलर केसेस इट विल बी हेल्पफुल. तो ऍक्शन ऑफ ग्लुटेमिक ऍसिड अँड दिस ऍसिड मिनरल्स, सेंधव इज व्हेरी मच एनरिच. So I not only preach and not only taking lecture or particular giving advice or suggestion, I myself is following. I have arrested that particular, my audiometry is normal and my presbyopic changes I could postpone, and I am 54 and I can read, and I have a normal 6/6 and N/6 vision. In terms of Ayurveda, I am following Sastrutta, Rutucharya, Dinacharya, whatever. And if me, why not others? I always think yes, everyone should be benefited, mankind should be benefited, and for that my 2 YouTube's videos I have there, management of hearing loss and बढ़ते हुए चश्मे का नंबर कैसे कम करें. ये दोन्ही व्हिडिओ माझे YouTube वर आहे, YMT YouTube चॅनल वर. So copper improves the immune system, thus overall health is affected. Choline is similar to vitamin B12. कोलिन इज सिमिलर टू व्हिटॅमिन बी12. ऍज आपण ताम्र भस्म आणि सगळे भस्म बृहत्वत चिंतामणीमध्ये सगळे भस्म आहेत, रजत भस्म, स्वर्ण भस्म, बृहत्वत चिंतामणी गोल्ड, गोदंती भस्माच्या कॉम्बिनेशन मध्ये 125 मिलीग्राम आपण देतो बीडी. आणि जर हे सगळं अग्नी बिघडलेलं आहे आणि आपण हे सगळा वर्षाव केला, कर्णपुरण, नस्स, बस्ती, सगळं महावात, विध्वंस, बृहत्वत चिंतामणी, इट विल ऑल गोज इन व्हेन. If properly Prakriti is not assessed, when there is no properly जठराग्नी और अग्नी जर तुमचा नाही आहे व्यवस्थित, प्रत्येक रसधातूचा अग्नी आहे, मज्जाधातूचा अग्नी आहे, अस्थिधातूचा अग्नी आहे, ऑटोस्क्लोरोसिस आहे का तुम्हाला, बिकॉज ऑफ ऑटोस्क्लोरोसिस देर इज अ टेपनेस, देर इज अन अनदर इश्यू, तेव्हा तुम्हाला अस्थि पोषक पण द्रव्य द्यायची असतात. सो दॅट काइंड ऑफ कर्णपूर्णा सेसम ऑइल we advocate. The treatment plan for vataja disorders are best treated with snehana, as I told. Karnanada is Vata's disorder, so treatment will be Snehana again. Karnapurana or Snehana. देन नस्य कर्मा ऍज कर्णपूर्णा मी तुम्हाला सांगितलं की ऑडिटरी कॅनल मध्ये भ्राजक पित्त आहे आणि भ्राजक पित्त हा फक्त कर्ण ऑडिटरी कॅनल मधल्या स्किन नाही, आपली संपूर्ण स्किन तेथे भ्राजक पित्त आहे आणि त्या ऑडिटरी कॅनल मध्ये टाकलेले जे ऑइल आहे ते पूर्ण स्किन मध्ये तुमच्या जातं भ्राजक पित्त सगळीकडे असल्यामुळे, बिकॉज ओलिएशन अँड फर्मेंटेशन आपण केलेलं असतं आणि तिथलं व्हॉसोडायलेटेशन आणि परमेबिलिटी ऑफ द पर्टिक्युलर ब्लड सर्क्युलेशन इम्प्रूव्ह होऊन तुमचं ते त्या मेन सिस्टमिक इंटरव्हेन्शन मध्ये ते होतं. अगेन आता जर कोणी मॉडर्नचा पर्सन असेल तर देन वी कॅन अगेन अनदर फॉर्म अ टीम and we can again work on this particular pharmacodynamics and pharmacokinetics issue. As far as नस्य कर्मा 5,000 वर्षापूर्वी सुश्रुताने लिहून ठेवलंय की गर्भिणीला नस्य द्यायचं नाही. why it is said that गर्भिणीला नस्य द्यायचं नाही, दुर्दी नसेल तर नस्य नाही, because they knew we put the nasal drops inside, what will happen, these drops will never cross the cribriform plate, it will not reach to the intracranium, but there's a chemical impulse, there are impulses, magnetic impulses, electrical impulses, chemical impulses, electromagnetic impulses. That chemical impulse will reach जो अणु तेलामध्ये, म्हणून त्याला अणुत्व इतकं प्राप्त करायचं आहे की that chemical impulse will reaches through cross the cribriform plate, reaches to the Shrungatak marma, and that Shrungatak marma is situated at the base of the hypothalamus or pituitary stalk of the pituitary gland. Pituitary gland is a governing gland and it gives direction and order to all adrenal glands to ovaries, and if at all we stimulate this particular pituitary gland, it will stimulate the ovaries and then ovarian uterine contraction and all these things will start. That kind of thought they knew 5,000 years back. When I was student, I used to wonder why नाकात औषध टाकलं तर असं काय होतंय, गर्भिणीला का नाही द्यायचं बाबा, नाकात औषध टाकलं तर असं काय ओव्हरीज पर्यंत पोहोचणार आहे ते औषध, असं मला वाटायचं when I was studying in government Ayurvedic college Nagpur. So that kind of hypothalamus and chemical impulse therapy, electromagnetic impulse जातं, USG चे अल्ट्रासाउंड वेव्ह जातात क्रॉस करून, तो इम्पल्स सुद्धा तुमचा जातो that through your olfactory bulbs चे nerve tissues आहेत. So नस्य is among the 5 steps of पंचकर्मा and it is a nasa of शिरसोद्वारम, आणि नस्याने सुद्धा तुमचा tinnitus आणि hearing deafness कमी होतो. Your improve your eyesight, there are n number of paralysis, all of us know the what is the particular action of nasya. So according to Ayurveda, before giving nasya, patient should be receive snehana svedana, because modern studies had proved that application of heat and muscular exercise accelerates the drug absorption through vascular path by increasing blood flow. It will accelerate the drug absorption by improving the vascular path and increasing the blood flow. So it will reach to the system. Moreover, this balatel abhyanga followed by svedana stimulates sensory nerve endings. मी फक्त नस्य देऊन पण पाहिलंय पेशंटला, बघूया किती ऑडिओमेट्री मध्ये फरक पडतो. नस्य आणि कर्णपूर्णाचं कॉम्बिनेशन करूया किंवा फक्त मात्रा बस्ती देऊया पेशंटला आणि अभ्यंतर देऊया मात्रा बस्ती आणि बघूया विच वन इज मोर वेदर टॉपिकल. आता बरेच लोक मोड ऑफ ऍक्शनच्या नुसार याला टॉपिकल म्हणतात, बट इट इज नॉट टॉपिकल. जस्ट नाउ आय टोल्ड यू इट विथ द ड्रग इटसेल्फ विच इज इंट्रोड्यूस इन द आईज इन टर्म्स ऑफ तर्पणा, or it afterward it will reach to the systemic circulation, and this which drug which put or tail or sesame oil or whatever medicine we instill into the auditory canal or into the nose, that will also has a larger impact through by improving blood circulation, means it reaches to the main blood flow or circulatory system. So in that particular long way to go, we have a long way to go to establish our theory. Still I am aware of, before making a tall claims, I am still aware that still we need a pharmacologist or a ENT surgeon or ophthalmologist or a person from Shalakya and person from Rasashastra. Then we can come together, form a team, and we can definitely reach this particular our Kriya-Kalpas to a greater heights. So नेझल स्प्रे त्यांनी काढला. कुठून काढलाय नेझल स्प्रे? नेझल स्प्रे काढलाय तिथून त्यांना माहिती होतं की शॉर्ट ड्रग डिलिव्हरी. इन द सेम वे बायपास द सिस्टमिक सर्क्युलेशन इंटरव्हेन्शन करण्याच्या ऐवजी त्यांनी ते नस्य सांगितलंय. तो बाय इट विल स्टिम्युलेट द सेन्सरी नर्व एंडिंग्स. ऑल्फॅक्टरी बल्ब तिथे असतात, शृंगाटक मर्म तिथे आहे, त्याचं स्टॉक ऑफ द पिच्युटरी ग्लँड आहे. फेशियल मसल्स बाय स्ट्रेंथनिंग बल्य उष्ण और वातहर गुणा. बल्य उष्ण वातहर गुणा, स्नेहना स्वेदना ओलिएशन, दॅट काइंड ऑफ. आता तो इम्पल्सची थिअरी आहे. डेफिनेटली डेफिनेटली इट इज अ, मला यात काही शंका नाही, जो केमिकल इम्पल्स जो जातो, की मी साधं तेल पण टाकून बघितलं की अणुतेलाचे किंवा घृताचे, काही पेशंटला घृताने रिझल्ट मिळतो. नेझल म्युकोझल मेम्ब्रेन, नेझल म्युकोझल मेम्ब्रेन म्हणजे वाढलेला वात जो आहे, इसलिए अणुतेल नसतं. वी आर लुब्रिकेटिंग द नेझल म्युकोझा अँड ऍट द आफ्टर 2 days 30 ते 40 शिंका पेशंटला येतात. ॲलर्जिक रेनायटिस, व्हॉसोमोटर रेनायटिसच्या केसेस माझ्याकडे येतात. आणि आपण जेव्हा नस्य देतो, मग केशर घृताचं नस्य असो, शुंठी तेल नस्य असो, एसटी मधून, आणि आफ्टर 2 days ऑफ वन्स आय ऍडमिनिस्टर द ड्रग, पेशंट सांगतो मॅडम मला 40 शिंका येत होता, 30 येत होत्या, आता फक्त 5 आणि 6 शिंका येतात. म्हणजे वी आर डुईंग द लुब्रिकेशन ऑफ द नेझल म्युकोझल मेम्ब्रेन अँड देअर बाय ऑल्फॅक्टरी नर्व फायबर्स त्याचे स्प्रेड आहे, आणि तिथून दॅट इम्पल्स रिचेस टू द शृंगाटक मर्मा through this cribriform plate, and through this cribriform plate it induces the action by crossing that particular all harmonizes. नसं केलं पेशंटला झोप येते चांगली. कशी झोप येते? तिथे इमोशनल आउटबर्स्ट असेल, हायपोथॅलॅमस इट कंट्रोल्स अवर इमोशन्स, ऑल ऑफ यू नो. and all of you know Shrungatak Marma theory, hypothalamus and pituitary gland. It is a governing gland. It harmonizes the pituitary gland. And harmony comes into our life. मग तुमचं पीसीओडी असो, सेकंडरी इन्फर्टिलिटी असो, इकडे नसतं दिलं तर तिकडे मेन्सेस सुरू होतात. असे पण पेशंट बघितले मी, सेकंडरी एमनोरियाचे पेशंट. सो as I have been in रसशास्त्र, I used to practice modern medicine, this particular सगळे जे आपण काय चिकित्सा झाल्यानंतर आपण जी प्रॅक्टिस करतो, देन आय हॅव स्टार्टेड शालाक्यमध्ये नंतर मी करून केले. सो द बला तेल इज प्रिस्क्राइब्ड इन ऑल वात डिसऑर्डर्स, सुश्रुत संहिता, अँड हॅव जीवन, बृहण, रसायन, इंद्रिय प्रसादन प्रॉपर्टीज. जीवनीय, बृहणीय, इंद्रिय रसायन चूर्ण तर तुम्हाला द्यायचंच आहे. पहिल्यांदा आमपाचन केल्याशिवाय हे काहीही कामात होणार नाही. तर नेझल रूट, जस्ट आय डिस्कस्ड विथ यू. नोज इज सेट द गेटवे ऑफ cranial cavity, and all diseases of supraclavicular part can be managed by नस्य कर्मा. नस्य कर्मामध्ये तुमचं इन्फर्टिलिटी, पीसीओडी, टिनिटस, डेफनेस, all kind of issue. Just now I told you that it goes into the intracranial, means Shrungatak Marma, and it induces the harmony. That it will enrich all trail cranial nerves. It will enrich all your adrenal cortex to ovary gland of ovary, to your thyroid gland, definitely, everyone. So the drug administered through nose stimulate the higher centers of brain, which shows action and regulation of the nervous system functions. नावन नस्य, there are an Ayurvedic नस्य 8 to 8 drops. बला तेल नस्य, there are षष्टीमधु तेल नस्य. सिंपल बिलवादी तेल मी नस्य पण देते, बिलवादी तेल नस्य पण देते, तेच कर्णपूर्णाला पण वापरते. अश्वगंधाचं नस्य पण देते, तेच कर्णपूर्णाला वापरते. दशमूळ नस्य पण देते, तेच कर्णपूर्णाला पण वापरते. असं काही नाही. सिंपल घृत ऑल्सो यू कॅन ऍडव्होकेट, राईट? सो दिस काइंड ऑफ नावन नस्य. Therefore, Navana Nassa with Bala Tela elevates the vitiated Vata dosha and provide nourishment to the nervous system, thereby helps in improving the symptoms of the tinnitus. Kavala Gandush also helps to certain extent. So Kavala and Gandush, all of we know the certain liquids are to be said to hold. To withholding the medicated oils or certain liquids in the mouth for a certain period of time strengthens the nerves near to eyes, ears, and pacifies the aggravated Vata dosha. And I was doing my post-graduation in Shalakya, oral submucous fibrosis topic घेतला. तर I used to visit to St. George Hospital, and thereby it gives oral submucous fibrosis मध्ये Placentrex and corticosteroid they used to inject this particular trismus जे कमी करायचं असेल त्या पिरियडला गंडूश ऑफ तिल तेल or certain kind of oils I have made and I used to give the गंडेशा, then the trismus was reduced. म्हणजे त्याला आपण म्हणतो की पेशंट वॉज बेनिफिट. त्या B12 थेरपी आणि कॉर्टिकोस्टेरॉइडला पण तेवढेच रिझल्ट होते, त्याच्यापेक्षा जास्त रिझल्ट गंडूश आणि पेशंटला मिळाले. सो गंडूश अँड कवल डेफिनेटली इट हॅज अ ड्रग ऍब्सॉर्प्शन थ्रू स्किन, थ्रू युअर टिश्यू. सो स्ट्रेंथेन्स द नर्वस नियर टू द आईज अँड इयर्स, ऑल्सो पॅसिफाईज द ऍग्रेवेटेड. खूप वेळा जर आपण गंडूश धरून ठेवलं तर डोळ्यातून पाणी येतं. जर जास्त वेळ आपण गंडूशाचं द्रव्य धारण केलं तर काय होतं, डोळ्यातून पाणी यायला लागतं. व्हॉट डज इट मीन? इट डेफिनेटली स्टिम्युलेट युअर नर्व्स. जे पण तुमचे नर्व्स आहेत, तुमचे लॅक्रिमल फ्लुइड जे टिअर ग्लँड्स आहेत, त्या टीयर सिक्रेशन होत आहे म्हणजे डेफिनेटली स्टिम्युलेट युअर नर्वस सिस्टीम. सो जास्त वेळ होल्ड करून ठेवलं. आणि म्हणजे कितपर्यंत करावं गंडूश? जोपर्यंत तुमच्या डोळ्यातून पाणी येत नाही, जोपर्यंत तुमच्या नर्वस सिस्टीमला टिश्यूजला जर्क होत नाही किंवा स्टिम्युलेशन मिळत नाही, तोपर्यंत तुम्ही गंडूश करावा, गंडूश धरून ठेवावा. दॅट काइंड ऑफ यू हॅव टू होल्ड अ पर्टिक्युलर क्वाथ, मेडिसिन or sesame oil, daru haldi, yashti mudu, trifla, dashamul, and number of things. We can make a decoction, we can hold this sesame oil or a different gruta, and then it will not only superficial impact for mouth ulcers I am talking, it has having larger impact on eyes, on face, on your facial palsy, on tinnitus or sensorineural deafness. That kind of cover a gandush, it stimulates the nerve tissue. That's why डोळ्याला पाणी येतं. That's why tear secretion occur when we hold the particular gargle. So vata balancing therapies and herbs that reduce vata are beneficial in vata disorders. So Brahmi Rasayan improves tinnitus by direct enrichment of the nutritional quality of rasa and promoting nutrition, improving Dhatvagni, Bhutagni. I would conclude the lecture with this particular aspect of Brahmi Rasayan and how Dhatvagni, Bhutagni and Jataragni promoting the competence of Srotasa. So through micro channels, through digestion, through microcirculatory channels in the body, and ultimately rejuvenating the auditory function. So a role of Kapikuchu, I would conclude this within 2 to 3 slides are left and I would conclude my lecture. So it is tested and proved that drug Kapikuchu also I used. So it has a align, glycine, citracystine, histidine and dopamine. It will increase the dopamine. So dopamine level जी आहे त्या dopamine level ला equilibrium आणण्याचं काम Kapikuchu करते. These ingredients are very useful in regeneration of neurons and neuroprotein. The concept of Karnanada to the modern therapies, there is a degeneration of neurons, cochlear nerve, loose hair cells, and loss of cochlear ganglionic cells. So, hey, role of Kapikuchu is very much important, and if it is given with a milk, then it is a beneficial. So, Kapikuchu, all of you know, the acetylcysteine is capable of preventing age-related hearing loss, and acetylcysteine can stop damage to the inner cells, which helps to reduce age-related hearing loss. And linoleic acid and types of ingredients which is described in Materia Medica are useful to strengthen the hearing system. This L-agrenine successfully works in angina, strokes, and it is also studied on 12 patients with profound hearing loss. Profound hearing loss वर सर Kapikuchuचा रोल जो आहे हा it occurs, it has contains as arginine L. तर हे how drugs work, again that I told you की सप्तधातु पोषक आहे. It gives nourishment to the Majja Dhatu. It protective and neuroregenerating, and Balya property it is having. The concept of Badhirya, according to Mother Time, there is a degeneration of neurons of cochlear nerve, loss of hair cells, and cochlear ganglionic cells. And Sarshaptela, garlic oil, this kind of treatment, it works particularly Shirabala capsule, particularly this Shirabala capsule and Dashamula Rishta, Sarivadivati and Induvati. The drugs like Gugulu, Jatamansi, Agru, Sarshapa, Haridra, it works on sensorineural deafness. Though this is not a particular topic of our Kriya-Kalpa, how our Kriya-Kalpa works. So apart from Nasya, Gandusha and Karnapurana, these 3 Kriya-Kalpas are beneficial. But if you administer the drug through Pakvashaya or through Basti, that would be more beneficial for the degenerative kind of ear disease. Just like some of the pilot studies I have conducted on Suvarna Sutta Shekara, Jivantadi Gruta Nasya and Chandan Bala Lakshari Taila Nasya, याचा सुद्धा अतिशय खूप चांगला रोल आहे. कुठले इन्ग्रेडियंट्स पिक करावे, एरंडा, रासना, अश्वगंधा, निर्गुंडी आणि दशमूळ आणि बिल्व हे घेऊन त्याचे परम्युटेशन कॉम्बिनेशन करून तुम्ही कर्णपूर्ण आणि नस्यासाठी द्रव्य बनवू शकता. So action of Karnapurna just now elaborated. Action of Karnapurna, Indriya Dorbalya occurs with aging, and that is decrease presbycusis, that Vata predominance in old age and decreased nutrition to Uttarotter Dhatus occur, and thereby tinnitus occur. So concluding statement of my today's lecture is, as per Ayurveda classics, the sign and symptoms of tinnitus stimulates with Karnanada, which results to aggravated Vata Dasha. Therefore, the treatment principle given by Acharya Sushruta mainly concentrates on Vata pacification, nourishment through Nasya, Karnapurana, and that particular Basti. So in the modern era, people follow the unhealthy lifestyle that we have discussed earlier. So management of the disease is important, and patient should be given rasayana therapy, grutapana and nasya, but bringing body back to balance. So another important point I would like to make in this today's lecture, that we should advocate the patient for supernasya, or this particular supernasya is recently lymphatic vessels that drain toxins from the brain were discovered at the University of Virginia. Lymphatic vessels that drain toxins from the brain were discovered at the University of Virginia. These vessels are in exact same location Vedic texts described thousands of years ago. Ayurveda also described the technique to detoxify brain lymph that is still practiced today. Powerful Ayurvedic therapy to balance the vata in the head, neck and cervical lymphatics that brain inner ear. त्यांनी जी थिअरी सांगितली आहे ती युनिव्हर्सिटी ऑफ व्हर्जिनियाला केलेलं आहे त्यांनी, ती नस्सची थेरपी, सुपर नस्स, त्या सगळ्यात इम्पॉर्टंट आस्पेक्ट मॉडर्न सायन्स विसरलं आहे. And that aspect, just now I was speaking, holistic way to heal the patients of ENT disorders, and especially tinnitus. Can meditation help soothe the techniques? Yes, meditation definitely help, because what is meditation? That prevents, that concentrate on our inner, when the number of thoughts are reduced, and जेव्हा विचारांचा गोंधळ थांबतो तेव्हा तुमच्या कॉक्लिअर नर्वला, तुमच्या एंडोक्राइन याला हार्मनी येते बिकॉज ऑफ मेडिटेशन, and definitely that will improve the health of your sense organs. So meditation helps to pacify the aggravated vata dosha. It will minimize the thought and it will give emotional response to the center. In that way your meditation will help. So vipassana, art of living, or Raja Yoga meditation, paying much attention in the present moment, non-judgmentally, it is a technique designed to help one purposely pay attention to the present experience without judgment or taking ownership of the many thoughts and emotional reactions that can become attached to the situation or stimuli. We can give the stimuli, we can reduce the stimuli by doing meditation. Meditation म्हणजे meditation करून तुम्ही एंडोक्राइन हार्मनी आणू शकता आणि विचार सुद्धा कमी करू शकता. त्याच्यामुळे तुमचा कानात येणारा आवाज सुद्धा हा कमी होतो आणि तुमची धातुक्षय कमी होऊन तुमची वाढलेला वाचवा तुमचा कमी होतो. So a desensitization program based on this would be really suited to tinnitus sufferers. Meditation, nasal breathing exercises to slow brain waves, distress the body and stimulates the parasympathetic nervous system that rebuilds the body and balances the vata of the nervous system. So explore another way of treating tinnitus. I would like to say की जे मेडिटेशन आहे, आता परत जसं आता क्रियाकल्प, माझं लेक्चर थोडं लांबलं आहे, हा क्रियाकल्प जसा आस्पेक्ट आपण म्हणतो तसाच मेडिटेशन या आस्पेक्ट कडे दुर्लक्ष झालंय. वेन वी इनकल्केट द पर्टिक्युलर ट्रीटमेंट प्रोटोकॉल, मेडिटेशन, विपश्यना, राजयोग फाउंडेशन और आर्ट ऑफ लिविंग, वॉट एवर that particular, if you advise the patient go for meditation, then definitely right from hearing capacity to all your problems like tinnitus, that will get resolved. And with this I would like to conclude my lecture, and we should think particular 1 hour मध्ये मला मॉडर्न आणि कॉम्प्रिहेन्सिव्ह अप्रोच कव्हर नाही करता आला. So sorry for my lecture has been delayed. So thank you very much to the organizers and all Dharmantari Medical College staff and chairpersons, because all the seniors are sitting and listening me. So I am really thankful, sir, because lecture माझं 20 minutes ची जरा लांबलाय. So thank you very much.
Welcome, madam. Excellent speech, excellent lecture, excellent vocabulary, wide coverage on the both side, modern aspect and Ayurveda aspect. One question is the meditation is helpful? You have asked during lecture. Of course, samanya karna rogeshu ghrutopanam rasayanam. Achar rasayan is one of the rasayan. So meditation and keeping your mind quiet, all these things are useful for vata shamana. Actually, madam, vata prakop is a very difficult condition. See, loss of movement in the limb is vata prakop, and even tremors, excited movement, again this is vata prakop. So considering this wide range of Vata Prokop, we have to do the various kalpas what you have already well explained, madam. One, my experience I would like to add to the audience and to you also, that we were usually coming across with the patients of age-related macular degeneration. We used to give treatment for the timir, Vataja timir. Routine practice is giving Saptamrut Loha with 1 or 2 spoon of ghrita 1/2 to 1 hour before meal. It is supposed to be the Vayana Kala, so it is effective. It is our practice. We give with Triphala Grit Tarpan we give. So after in some patient, what the observation is that the patient came with the complaint that I have some better vision. I have some relief in my symptoms of the eyes during last 1 or 2 months, but previously I was unable to hear, or the previously I was having tinnitus, that is subsided totally.
Yes,
So
this is
this,
possible.
yeah, it is the effect of the Ghrita, and of course Saptamrut Loh is one of the rasayana. Its contains are the rasayan, so it is helpful. And one thing I would like to add, that Murda Taila should be given in any form. You can just perform the abhyang.
Shirodhara, Shirodhara.
Of course,
Shirodhara is
Shirodhara,
important aspect to reduce the tinnitus.
yes, yes.
It is
Shirodhara,
induces again Shrungatak Marma and this harmonize the
yes,
channel.
yes, yes, yes.
Shirodhara. Yeah.
Yes, but what happens, madam, to give Shirodhara, we have to do that all this procedure. What is our practice? I used to ask patient to put 10-20 ml tail here and massage. Like Talu Puran is done in the children in our Indian, it is one just a abhyang in a rich quantity. Okay, abhyang is the lowest among the this one, Murda Taila. It has lowest potency, but it can be performed easily and for a prolonged period of time. And Basti, you have advocated well, madam. It is the Moolasthana of Vata. We have to go there and we have to
Seize out.
perform the generalized Vata Shaman, and it can be achieved with the Matra Basti. And in Vyanakala, Ghrita Sevan can be recommended. And before that, one thing I would like to elaborate, that first we have to diagnose whether it is due to the Vata Shaman or Vata Prokop, or due to the, as we know, that the tinnitus associated with the hearing loss usually is due to the incomplete neuronal damage. Those incomplete neurons at the inner ear level, in the nerve level, in the central level, those incomplete damage is responsible for the tinnitus. So we have to first diagnose whether it is a Vata Prokopaj, or we have that it is secondary. And for various secondary causes, we all know that we have to first treat if it is secondary to some another thing, simple hypertension or some aneurysm or some SOL, etc. We have to go in search of that.
Sir,
And after that,
I would like to add one more important findings related to the hypertension. Sir,
yes,
hypertension के जो patient है, I have 10 patients with me. अगर
yes,
उनका blood pressure लिया जाए before 170, 100, 150,
yes,
100, that kind of. If this patient undergo Shirodhara and
yeah,
Nasya, and
yeah,
then immediately once this Shirodhara is completed and then you take pressure, this
yeah,
comes to 130. जो 150 था जो 130 था. 130
good,
और 90 के ऊपर आता है. There are n
yes,
numbers of, just I told you, enriched material. And yes, meditation helps, because after meditation आप research articles से कि आप EEG करते हैं, number
yeah,
of thought, electroencephalogram, number of thoughts get reduced.
yeah, of course,
The tinnitus का noise also get reduced
yes,
with this
yes.
particular. After all, it's a noise.
Just first, and at the end, I would like to give my compliments to the Sunita Magar madam for a very useful topic and well explained. And one another speaker, previous speaker, Dr. Manjari Keskar, she has covered a lot. very good. Dr. Kale sir, I have seen him after a long time. Dr. Dhate, Rajendra Dhate is my student. Nice to see coordinating for this seminar. And Dr. Ravikant Patil sir and Dr. Milind Gore, co-chairman, my co-chairman. Milind Gore, some comments from you, please.
Yes, sir. सर सबसे पहले मैं जो धन्वंतरी आयुर्वेद कॉलेज के प्रिंसिपल है डॉक्टर दत्ता पाटिल सर, उसके दाटे सर और रविकांत पाटिल सर, इनका मैं आभार व्यक्त करना चाहूंगा कि इन्होंने मुझे अपॉर्चुनिटी दी कि को चेयर पर्सन करके काम करने की, और वो भी आपके साथ में, ये मेरा सम्मान है। डॉक्टर सुनीता मगर मैडम ने बहुत ही अच्छी तरह से ये टॉपिक जो सिलेक्ट किया है और जो सोशली बहुत ही इम्पोर्टेंट है, और जो वो रिसर्च कर रहे हैं वो रिसर्च, जस्ट मैं वीडियो ऑन करता हूँ, तो ये रिसर्च टॉपिक जो है उन्होंने सिलेक्ट किया हुआ, ये डायग्नोस करने के लिए तो डिफिकल्ट है ही, मगर सोशली ये उस पर्सन को काफी अफेक्ट करता है, सोशली डिस्कनेक्ट करता है। इस टॉपिक पर ये जो डिवोशन से काम कर रही है, उसके लिए मैं सबसे पहले उन्हें कॉन्ग्रेचुलेशंस करता हूँ, और ऐसा ही काम उनका आगे चलता रहे। उन्होंने सभी एस्पेक्ट से इस डिसीज पर विचार करने के लिए हमें एक दिशा दी है, जिसमें बस्ती चिकित्सा, आम पाचन, गंडूश, नस्य, इन सभी एस्पेक्ट जो है इनको टच किया है, और इसका यूज किस तरह हम बेहतर करके पेशेंट को रिलीफ दे सकते हैं, इसके लिए हमें गाइडेंस किया, इसलिए मैं उन्हें थैंक्स कहता हूँ। थैंक यू सर।
Thank you. And once again, I would like to thank Dr. Dattatreya Patil, principal. He is again my student. Dr. Deepak Sawant, I am seeing him. He is here. And Dr. Rajendra Dhate sir, he is the coordinator. So thank you all for organizing such a seminar, and it will be surely beneficial for students, and it is surely beneficial as a reminder. Again, just seminars are the things which strengthens your strengths and weakens your weaknesses. So thank you. Some comments from Sharma sir, I would like to hear.
सर नमस्कार, गुड आफ्टरनून।
Good afternoon. Namaskar.
आवाज आती है सर?
Yes, yes, you are audible. आ रही है सर आवाज।
सर सर्वप्रथम I am sorry to join few minutes late because some technical problem in my mobile.
But sir, you are from a very good time you are hearing. You are with us, sir. I am seeing
Yes,
you.
sir.
Yes.
Yes, sir. सबसे पहले तो मैं मगर मैडम के प्रेजेंटेशन के लिए गोवा में जो उनको अवार्ड मिला उसके लिए उनको बधाई।
मेरी तरफ से भी बोलना रह गया था मैडम।
थैंक यू सर।
मैं नहीं भूलता सर। और दोनों मैडम का प्रेजेंटेशन बहुत ही सुंदर रहा। मेरे ऑब्जर्वेशन के अनुसार 12 से लेकर के 25 साल के उम्र के जितने भी बच्चे हैं, दोनों मैडम से हमारा रिक्वेस्ट है कि मोबाइल से रिलेटेड जो उन्होंने बताया, ईयरफोन और मोबाइल का यूज, और तीसरी चीज सबसे इम्पोर्टेंट कहा कि हियरिंग लॉस इंप्रूव होता है साउंड स्लीप से, और रात को 2 बजे तक बच्चे मोबाइल देखते हैं, हमारे घर के भी बच्चे वही करते हैं।
Yes, yes.
उनको साउंड स्लीप कभी नहीं मिलता। तो मेरा ये रिक्वेस्ट है कि इसके माध्यम से, यूट्यूब के माध्यम से, जैसे भी हो, जन जागरूक अभियान इस रूप में अगर हम शुरू करते हैं तो निश्चित रूप से ये जो यंग जनरेशन है उनको फायदा होगा। वो लोग सभी जानते समझते हैं, लेकिन वो इस पे ध्यान नहीं देते, इस रूप में बताने वाला कोई नहीं मिलता। तो मेरा मैडम से ये आग्रह है कि इस तरह का कार्यक्रम जन जागरूकता के रूप में निश्चित रूप से प्रारंभ करें।
सर मेरा YMT यूट्यूब चैनल हमारा है, डॉक्टर सुनीता मगर YMT यूट्यूब चैनल। ऑलरेडी जब से कोरोना आया, मैनेजमेंट ऑफ हियरिंग लॉस, बढ़ते चश्मे का नंबर कैसे कम करे, गुडुची अ ग्रेट इम्यूनिटी बूस्टर, ये सब 3-4 वीडियो मैंने डाले हैं, और ये जस्ट टू एजुकेट द सोसाइटी। just to create an awareness among youngsters, see what they are going to do with their sense organs, eyes or ears. तो ये है सर, YouTube पे है मेरे वीडियोस.
ओके मैडम, थैंक यू. और विशेष रूप से दत्ता पाटिल सर और उनके मैनेजमेंट के लोग, बाकी चेयरमैन, को चेयरमैन, कोऑर्डिनेटर, सबको हार्दिक बधाई. और ये कार्यक्रम बहुत ही बढ़िया सुचारू रूप से चला, ढंग से लोगों ने साथ दिया, सुना. एक बार पुनः सबको धन्यवाद. थैंक यू.
Thank you, sir. Now over to coordinator. Please, sir.
Thank you, ma'am. We have very profound knowledge of endeavor. I think all major
I think there is some disturbance in the audio.
Sir, your voice is breaking.
Chairman,
Yes,
sir.
Voice is breaking.
Hello. Hello.
Hi. Now you are
Meeting,
audible.
sir?
Yes.
Yes. I think all major points are covered related to tinnitus. With appropriate examples, madam. I would like to thank you, Chairman sir and Co-Chairman sir, for their thoughtful address and comments on these subjects. Now coming to last part of the session, that is vote of thanks. I would like to thank Chairman sir, that is Khan sir, to addressing us and their richful comments. We will definitely follow your tips, sir. I also would like to thank Co-Chairman sir, Dr. Milind Gore sir, to their comments and notes. I would like to thank Dr. Sunita Magar ma'am for her graceful lecture and address, which will be helpful for us of all students and practitioners also, and teaching staffs in practice future also. Also, I would like to thank all observers from MUHS, that is Sharma sir, Zoom linkers, participants, YouTube linkers, जो भी है. I would like to thankful for our institution and principal sir, Dr. Datta Patil sir, who are allowing us to this national webinar, and organizing committee members, that is Dr. Pushpa Gode ma'am, Dr. Rashmi Chidre ma'am, Dr. Rakhi Varnade ma'am, and Dr. Vaibhav Biradar sir. So behalf of the chairman, I would like to close this second session, and very much thankful for us, you. Sir.
Thank you.
Dr. Avinash sir, any note from your side, sir?
A small announcement for the delegates.
Yes.
Please fill the feedback form. After filling the feedback form, the certificates will be automatically generated, and these will be dispatched within 15 days. Please fill the feedback form because whoever is not filling the feedback form, the certificate will not be generated. Thank you.
Okay. Thank you, sir. Thank you, everybody.
Thank you.
Thank you, Dr.
Thank you, all of
Khan,
us.
sir, ma'am. Okay. Thank you.
Thank you. Bye. Thank you, madam.